swift as the wind. No trouble at all. No trouble at all. Good evening, Rara!
Shakes these trails, they all derail. Phony, false, and frail. An empty ocean, lost our way with no direction home. Golden needles, names we take in vain. Find it harder to remain. Nothing sacred, still waiting on that explanation. Right before my eyes, I saw the whole world lose control. The whole world lost control before my eyes. I fell through the floor. I couldn't take it anymore. I can't take this anymore. It breaks my mind. Pleasure from the pain. Softly screaming, the pistol that you raise is spoken. Golden needles, names we take in vain. Find it harder to remain. No, nothing
Our daughter Jessie loves playing detective.
A clue.
But since we discovered she has sensitive skin, we've been playing detective too.
We thought the problem was our puppy.
Doesn't anybody care what I think?
Keep your opinions to yourself. Get so worked up, oh my god, that must be bad for your health. Keep your opinions to yourself. Wish you would take that energy and bring it somewhere else. You're hiding out in the comments while I simmer low. Keep your opinions to yourself.
The road before us
Let
is
it go.
clear.
You wanna lose type, thinking you're so righteous. How when you give off that vibe, looking at me with an evil eye. So lost in your ways, hit me with your bullets now, but we both bleed the same. Talking like you got something to gain. Cover me in kerosene. I know you disagree to disagree. Keep your opinions to yourself. Get so worked up, oh my god, that must be bad for your health. Keep your opinions to yourself. Wish you would take that energy and bring it somewhere else. You're hiding out in the comments while I simmer low. Keep your opinions to yourself. Shh, let it go. Just speaking your mind. I don't need an input, baby. Yeah, I'm doing just fine. You can live your life and I'll live mine. Negativity corrupts your mind. Wondering how do you sleep at night? Keep your opinions to yourself. Get so worked up, oh my god, that must be bad for your health. Keep your opinions to yourself. Wish you would take that energy and bring it somewhere else. You're hiding out in the comments while I simmer low. Keep your opinions to yourself. Shh, let it go. Keep your opinions, keep your opinions to yourself. Keep your opinions to yourself. You're so obsessed with me, yeah, you should really go and get help. Keep your opinions to yourself. You take that energy somewhere else. You're hiding out in the comments while I simmer low. Keep your opinions to yourself. Let it go. Keep your opinions to yourself. Let it go. Keep your opinions to yourself. Let it go.
Live reaction.
Oh, my YouTube's banned? No, dude, stop it. Oh my god, you're right. It's literally gone. Whatever.
People are spamming in chat that your YouTube channel got.
Oh, yeah,
deleted.
yeah. I think it's because, like, basically, I think what the strikes were gonna kick in, then I had, like, a counterclaim, and then it didn't kick in time or something like that, and it's auto-termination, but it comes back up. I'm sure you had that before where you have like multiple strikes and they're like all kicked in at the same time. See, the problem is that all the strikes kicked in at the same time, right? And that like since they didn't get fought and cleared at the same time, right? If one of them went through, because I was only on 3 strikes, I mean, it's instant GG. So
Sure.
So yes, that's true. As XQC says here, he received a copyright strike for content posted, must have hit the 4-strike limit, and gets automatically terminated. When a channel receives a strike, they can either accept the strike or fight it, but of course this process takes time and YouTube has to deal with that process. There is also human interaction included in that process as well, to make sure all the information provided is legitimate. So XQC's channel should come back up, but by the sounds of it, he doesn't really care anyway. So that's where I'm going to end today's video. If you made it to the end of today's video, I want to thank you all for watching as normal. I hope you enjoyed and have a wonderful day.
Use me too busy writing your tragedies. Use me too busy writing your tragedies.
I believe in murder. I believe in pain. I believe in cruelty and infidelity. I believe in slime and stink and in every...
Numb promises.
use to grade degenerative neuropathy. So I thought I'd quickly talk about the 5 stages and what is involved in each one of those 5 stages. So stage 1, very rarely do we see patients coming in and diagnosed at stage 1 unless they're a competition animal or a client that is very in tune with their pet. Most people put or miss stage 1 because they think it's hip dysplasia or some type of osteoarthritis or degenerative joint disease, because they start to see their pets scuffing along, so they're sliding their feet along the floor, they're shuffling along, they're not picking up and placing. They may notice that the innermost nails, so these are your thumbs, your dew claws, these nails start to wear because they're starting to drag their paws when they're going around corners, and that inner nail starts to wear. We may start to see that they're swaying a little bit in the back, and so these are very subtle changes. And so most pets, when we see them, or most patients when they come in to see me, we usually diagnose them around stage 2. So with stage 2, we start to see now wearing of all the nails, like they'll start to scrape. So you'll hear their click, click, click as they're walking, and that's them, instead of being able to place and move forward and up, they start to drag as they're coming through. We start to see changes in the tails. They're not wagging their tail or holding their tail up. The tail starts to look limp, and it will wag to side, but doesn't have that spring in it that it used to have. We start to see change in gait. So we're starting to see what's called the drunken sailor, when they're starting to stumble or they're stumbling. You may notice that they're falling over a little bit more. They may have issues standing up. So trying to get up, they may stumble a little bit and then get going. As I said, they may have more of that drunken sailor uncoordination. So while you're going to walk, they may start to trip. And you may look and say, well, something's really not right. They're tripping, they're more clumsy than usual. And these are usually the stages of stage 2. Stage 3 is where we then really get noticeable changes. So now they're stumbling when they're walking. They've got that really drunk sailor look. They're crossing their hind limbs as they're turning corners, and they're staggering around. They're now dragging through as they're stepping. So now wearing out the tops of their knuckles. When you look at the paw, all their nails will be worn down, but they're no longer placing and stepping through. They're placing and dragging through. We are losing muscle mass, so you'll see they're leaning out in the back and they're starting to look skinny in the rear end. We lose tail movement, so their tail's now flaccid, and it may move side to side, but there's no spring in their tail anymore. It just lays there limp, or may have lost all movement at all, so it just lies there. They may actually have problems getting up and not be able to get up at all, and you have to pick them up to get them on their feet, and then they start to move. But we're now seeing they're falling over, they're stumbling, their ability to move. They're now showing signs of urinary and fecal incontinence. You may need to support them with a supportive sling to help them go up and down stairs. We're now seeing physical mechanical involvement and also neurological involvement, where they're losing sensation of pain and touch in those rear limbs. Stage 4, we've got complete loss of function in the hind limbs, complete paralysis. There's no pain or sensation function anymore. They have muscle wastage, so you can see the bones of the hind limbs. They're very anorexic in those rear limbs for disuse atrophy. We have fecal and urinary incontinence. The disease is slowly starting to progress, so you can actually see it moving up, ascending up the spinal cord. But in stage 4, you have complete loss of all function and sensation, and as I said, urinary and fecal incontinence. Stage 5 is once now it's progressed to the forelimbs. So now you're seeing the signs that you saw back in the hind limbs, so loss of the ability to move, loss of function, starting to wear out of the nails, incorrect placement, loss of muscle mass at the front. They start to fall over, no longer can pull themselves late stage 5 is there, then you then for stage 6. No one really gets there because then stage 6 is paralysis of the diaphragm and they suffocate and die. So these are the 5 stages of how I stage and benchmark degenerative myelopathy for my patients. There are other staging systems out there, but this allows a good benchmark system so we can say, okay, we're transitioning from stage. So another question I get is, how can I make my beloved pet more comfortable once they have a diagnosis of degenerative myelopathy? And there's a lot of things that we can do around the environment, but also with your pet to help make them more comfortable. First thing is we need to get them into a physical therapy regime. We need to get them on supplements that help build muscle or prevent loss of muscle through atrophy or disuse atrophy, because we know as we lose those nerve cells in the spinal cord, they're no longer able to move as they used to, and that's usually what you're seeing because we get initial diagnosis around stage 2, sometimes stage 3 in the 5-stage system that I use to rank my degenerative myelopathy patients. So we want to build into their daily regime physical therapy activities to help slow down the progression of the disease. In their home environment, we want to put rugs down on the floor if there's slippery floor, wooden floors, tile floors, because we don't want them falling. We want to introduce bedding systems, soft beds, cushion beds, so that they're no longer lying on the bony points of their body. Their stifles, their hips, their shoulders, their elbows, because as they lose function in the rear limb, that means they're losing nerve function, so they lose the sensation as well. They can now start to get pressure necrosis or pressure sores, especially on the hips and the stifle as they're lying on hard surfaces. We want to introduce padding to their paws, so booties, wraps to help protect the paws as they're walking along. They're no longer able to place, lift up, they start to drag. And so we want to protect their toes, protect their carpus and their pads from getting wear injuries, because once we get wear injuries and scuff injuries, we now can get infection, and so we want to protect that. So really we want to think about ways we can protect the environment at home or when they're on their walks, always walking them on grass or soft surfaces, getting them off asphalt or concrete surfaces that start to wear again at their nails and their paws and their toes. So we want to start thinking about putting in place physical therapy to help build muscle, continue them moving, continue them being active, because that slows down the progression of the disease. We want to introduce supplements that have an antioxidant effect to help slow down the oxidative damage to that spinal cord. We want to introduce things into their home environment, so mats, rugs, carpets, bedding, to help minimize their chances of slipping, help minimize their chances of getting point necrosis lesions, but also maximize their comfort. And then thirdly, we want to introduce protective devices into their daily walk regime. So if they're walking on soft surfaces, sand, in water, if you have access to lakes or beaches, getting them off asphalt or concrete, or if they're on asphalt or concrete, then introducing booties or protective devices to help protect their paws. So hopefully this has given you a few ideas about what things you now need to start thinking about when we look to making them more comfortable with this disease.
An instructional video from the Canine Health Foundation. How to care for a dog with degenerative myelopathy.
Hello, I'm Krista Niebaum with Scouts House, a physical rehabilitation therapy center for animals located in California. I'm a physical therapist who works with veterinary professionals to help rehabilitate animals that are recovering from illness or injury, learning to live with a progressive disease, or simply dealing with the aging process. The topic of this video is the neurological disease degenerative myelopathy, or DM. DM is a diagnosis of exclusion, which means that a dog can only be said to have DM when a veterinarian has ruled out all other possible causes for the symptoms seen. While researchers are continuing to investigate this disease, little is known about DM, including its cause. And at the time of this filming, there is no cure. Because of this lack of knowledge, many owners of dogs with DM have difficulty finding information about how to best care for their dogs. The purpose of this video is to provide you with such information, allowing you to take an active role in caring for your canine companion as he lives with this disease. So what is known about DM? Degenerative myelopathy is a complex, slowly progressive disease of the spinal cord. Age of onset is typically reported as being anywhere between 5 and 14 years of age. Males and females are affected equally. DM is most commonly seen in German Shepherds, but it can affect other breeds, especially large breed dogs, including Boxers, Bernese Mountain Dogs, Old English Sheepdogs, and Irish Setters. Smaller breeds, such as Corgis, can also be given the diagnosis. Regardless of your dog's breed or the symptoms you're seeing, it's vital that your dog be examined by your veterinarian to obtain a correct diagnosis. Dr. Karen Blount is a veterinarian that sees many dogs with degenerative myelopathy. Thanks for talking with us today, Dr. Blount. So, Dr. Blount, I understand that DM is a diagnosis of exclusion, which means that other diagnoses or injuries have to be ruled out before a dog can be said to have DM.
That's true, Krista. There are several other diseases that an animal may have before we can rule in or out degenerative myelopathy, which include intravertebral disc disease, arthritis, lumbosacral disease, possibly even tumors.
I see. So what types of tests or measures might a veterinarian need to do if she suspects a dog has DM?
The first thing we need to do is a complete physical exam, looking specifically at the orthopedic and neurologic systems. Diagnostics would include blood work, x-rays, potentially ultrasounds, myelography, CSF taps, and even CAT scans or MRIs, depending on what we are or not finding.
And what kinds of treatment would you recommend for a dog with degenerative myelopathy?
Depending on whether or not we think pain is present, we may use pain medication, anti-inflammatories. We may consider alternative medicine like acupuncture, and most definitely physical therapy. I've seen many patients benefit significantly with just physical therapy and rehabilitation.
So let's take a closer look at this disease. When a dog is affected by degenerative myelopathy, the spinal cord slowly degenerates. The myelin, or the insulation of nerves, which is required for them to work properly, and the nerves themselves, called axons, are slowly destroyed. Since the nerves are what carry the signal from the brain to the muscles, this degeneration affects the dog's ability to voluntarily contract his muscles, resulting in the observed weakness beginning in the hind limbs. The first sign typically seen is that the dog is less stable in his hind legs. He may have greater difficulty rising from sitting into standing. He may seem less coordinated, and his back toenails may become worn down from his hind feet dragging when walking. Often the first thing that owners notice is hearing their dog's toenails scraping on the cement when out on a walk. As the disease progresses, the dog becomes weaker, and he loses awareness of where his hind limbs are. He may knuckle over on his back feet, and his coordination will worsen. His back legs may even cross while walking, getting tangled up. Finally, in later stages, the weakness worsens to the point that the dog is unable to walk using his hind limbs, or even rise up to standing without assistance. This stage typically occurs 3 to 6 months following initial diagnosis. Fecal and urinary incontinence may occur, and then the front limbs get weak as well. Following this, respiratory failure often occurs. However, most dogs are euthanized for quality of life reasons before this stage of disability is reached. The goals of treatment for DM are to maximize the dog's function and quality of life during each stage of the disease, and hopefully slowing the progression if possible. This may be one of the reasons why your veterinarian may recommend that your dog be seen for physical rehabilitation therapy. But before we discuss how rehab might be able to help, let's discuss some things that you can do in your own home to help keep your dog safe and more comfortable. For a dog with DM, the home can be a challenging environment. However, there are many things you can do to increase your dog's safety and comfort. If he has difficulty maintaining his balance when walking, and your floors are hardwood, linoleum, or tile, put down area rugs in the places where he normally walks. Rugs with a rubber backing are best for this use, but you can use other rugs. Just make sure you tack them down with double-sided carpet tape or rubber mesh to hold them in place. Another option for dealing with slippery surfaces is to teach your dog to wear booties. Be sure to get booties that will stay in place on your dog's feet and that have rubbery soles for gripping. Some booties are made to protect a dog's feet during sporting activities, not for improving traction. Also, because of decreased coordination, your dog may have trouble negotiating changes in elevation, such as stairs, furniture, or uneven surfaces in the yard. Use a baby gate or an X-pen to block off your dog's access to these places, or only allow her into these areas when someone is there to supervise her. And to get your dog in and out of the car safely, you can train your dog to use a ramp or a small set of steps. Always stay close by and keep a hand on your dog when she's walking up or down, and consider having her wear a sturdy harness in situations like this, because it creates a handle on your dog for you to hold, and it's much safer than holding her by the collar. Likewise, you can use a ramp or a small set of steps to get your dog on and off the bed or a couch. In addition to the front harnesses just shown, rear harnesses and slings can be helpful in assisting weaker dogs up into a standing position, or in giving extra support when walking. Of course, it's still important that your dog get good nutrition and adequate water. Sometimes for dogs with balance issues, it's hard to reach down to the floor to get their food and water. If that's the case with your dog, provide her with a raised feeder and water dish. And for dogs who can no longer stand for extended periods of time to eat, place the food and water bowls on rubber mesh pads on the floor. And remember, every extra pound of body weight makes it even more difficult for your dog to move, so be sure to keep her at her ideal body weight. When your dog has DM, you need to be careful about the types of bedding you use. Be sure to give him a soft, well-cushioned surface to lie on, but avoid dog beds with high edges, as this may trip up a dog who's weak in the back legs. In later stages of DM, good nursing care is key. If your dog is unable to get himself up or change positions every 4 to 6 hours or so, you must help him to do so to help prevent pressure sores. If your dog can't hold a position because of trunk weakness, you can use bolsters or rolled up blankets to help support him. As mentioned previously, it may also become necessary to assist your dog with her toileting needs. This may mean as little as providing some support with your hands or a harness so she can keep her balance while squatting, or if incontinence develops, you may need to ask your veterinarian to teach you how to help express her bladder. And be sure to keep her skin clean and dry if accidents occur. Products that can be helpful in this instance are absorptive training pads, disposable dog diapers, moisture-repellent ointments, and waterless shampoos. Good boy. Regardless of the stage of the disease, it's still important that you and your dog have fun together. So while you might not be able to throw the ball for him to chase, you can try throwing lob tosses directly to him or rolling the ball to him on the ground. Or if he's no longer able to go for longer walks unassisted, you can try using one of those rear harnesses or a cart. Typically with DM, the dog's cognition is not affected, so it's important to keep him mentally engaged and happy. Finally, there may be exercises you can do in the home to help maximize your dog's function. Your veterinarian or your physical rehab center can teach you exercises that you can do that are appropriate for your dog. Cairo, go get it! As mentioned, there currently is no cure for DM, but there are ways to help maximize your dog's strength and possibly slow the progression of the disease. A study recently published in the Journal of Veterinary Internal Medicine by Catman et al. Demonstrated that physical rehabilitation therapy helps to maintain the functional abilities of dogs with DM for a longer period of time, and therefore allows them to live longer, than dogs with DM who didn't follow a controlled exercise program. Certainly, keeping your dog as strong and fit as possible can only help. It's important, however, that the exercise program be designed specifically for your dog's needs. Especially when working with dogs with neurological deficits, it can be easy to inadvertently cause injury. Be sure to talk to your veterinarian about what types of exercises are safe for your dog, or have your veterinarian refer you to a physical rehabilitation therapy center. There are a number of treatment techniques and modalities that may be used if your dog is seen for rehabilitation therapy, depending on her functional status. Passive exercises such as range of motion, massage, or electrical stimulation may be used and might be included in a home exercise program for you to follow outside of the clinic. Aquatic therapy, such as underwater treadmill walking or facilitated swimming, can be especially helpful in maintaining the muscles used during walking. At Scouts House, we found that walking in an underwater treadmill can provide greater benefit to dogs with weakness in the rear legs as compared to swimming, as most dogs swim using only their front legs. And walking in an underwater treadmill can be safer than walking on dry land, as the water provides support, making falls less likely, and the exercise is less jarring to the dog's joints. However, as access to an underwater treadmill isn't always possible, your veterinarian may be able to suggest other similar activities, which may be appropriate for your dog. Various land-based exercises may also be performed, again depending on your dog's level of function and needs. Exercises will often focus on maintaining or improving strength, balance, body awareness, and coordination. Finally, a consultation with a skilled therapist at a physical rehabilitation therapy facility will be able to adjust your dog's treatment program and help you adjust your home life as your dog's needs change. It can be frightening to receive a diagnosis like degenerative myelopathy, but as we hope we've conveyed in this video, it doesn't necessarily mean that you and your dog can't still enjoy your time together. As is true with any disease, you'll likely need to make some changes and adjustments to deal with the challenges of DM. But with your help, your dog can still have a very meaningful life. And if his quality of life does become an issue, if the time comes to let your dog go, it will still be a very difficult decision. But you can make that decision without feeling any guilt, knowing that you helped your dog live his best possible life, despite his DM.
This video was made possible by a grant from the Canine Health Foundation. Additional sponsorship was provided by Scouts House, a physical rehabilitation center for animals, and the American Kennel Club. We're more than champion dogs, we're the dog's champion. And Purina, your pet, our passion.
Hi, Dr. John here. Now in the first video, people have been asking questions about what they can do. And really with DM, it comes down to 3 different areas. 1 is the home environment or the environment, 2 is the internal environment, things they can take, and 3 is supportive equipment and supportive services. So let's talk about the home environment. We know that it's a new, DM is a neurological disease. They're losing the ability of proprioception, knowing where their hind paws are in space. So now they're tripping, stumbling and falling over more easily. So we need to protect them. I say we need to pup-proof the house, almost like baby-proofing a house. So putting child gates or barriers at the top of stairs so they can't fall downstairs. Putting rugs down if you have slippery wooden floors, tile floors, so they can't slip and fall over and hurt themselves. Strategic putting rugs, mats around. Closing off areas if they could be running around pools or areas they could fall into and not be able to get out of. So it's really, we want to child-proof or pup-proof our house to make it a safer environment for them, because as they lose the ability to walk, they start to stumble around, they're going to fall over. And if they fall over, they now have the potential of breaking something, definitely bruising or hurting something. mobile longer, we know that that slows down the degeneration of the spinal cord and the nerves there, slows down the death of those axons, and would prolong their quality of life. But if they were to fall down the stairs that I've seen, break a limb, they're now not able to move, they're now no longer to keep muscle mass, coordination. We see the progression of the disease moves faster. So now that moves into what can we think about internally? We need to think about quality of life now. So it's flipping the whole, traditionally what we talk about in veterinary medicine, about putting things in place to extend the life, so supplements to protect joints, things like that. No, now we need to think about throwing everything at the kitchen sink at them when it comes to supplements and pharmaceuticals. Pharmaceuticals we need to have on board because we want to keep them comfortable. We know they're going to be falling over, stumbling into things, bruising themselves, wearing their paws, getting lesions on their paws, pressure sore necrosis. All these things hurt. And as they're losing the ability to feel pain in the hind limbs, and thank God that's the only blessing with DM, is it's a non-painful disease as they're losing the ability to feel. It still hurts as they're stumbling, falling, as they're progressing through the different 5 stages of the disease. So we need to have good pain control on board. We need to have good supplements on board as well, because there's some great supplements out there that have come out in the last 2 years that help build muscle, build mass, keep strength, slow down disuse atrophy. We need to have other supplements on board that increase the tensile strength of existing muscles, help with motion and lotion. And as I say, because we're needing to do all anti-inflammatories as well to help slow down the inflammatory process in the body, because we know it's that inflammatory process that's attacking the spinal cord. Then we come into the third phase, or third area, is what you can do for supportive equipment and services. So equipment, we know that we need to protect you as much as we need to help your beloved pet. And what do I mean by helping you? We know that this is the disease that affects large breed dogs predominantly. They're heavy, they're going to be needing to be lifted, carried, supported, turned. This puts a toll on you. And so we need to implement harnesses, lifting devices, carts, other things to help you to protect you, because if you get injured and you get hurt, now your pet is behind the 8 ball again, because they're not getting out, they're not getting exercise or the rehabilitation that they need to help support them. And so we need to support you. We need to also protect them. So with booties, with other devices that protect their paws, protect their hind limbs from when they're falling over, from lacerations, from other things. Other pieces of equipment that are specifically designed, like carts, and then modalities as well, like laser, underwater treadmill, soft tissue ultrasound, other things that have been shown to help slow down the progression of this disease. This is all brought together in what we call the multimodal approach. And these are things that you need to start thinking about with your pet as they progress through the different stages of DM, that at each stage we now are introducing different parts of different supplements, different equipment, different rehabilitation programs, different exercises to help match through all those different areas and to give you and your pet the best chance. Because I have clients that are physically not able to, through medical or other orthopedic disease that they have, or age, and so they need to go and find veterinarians or rehab practitioners that can help them with their pet with these services and help support them and their pet. So this is the nutshell. Hopefully that's answered some of your questions, but really it's coming to now thinking about different areas, the 3 different areas I talk about, I think about in life. So it's the home environment, the internal environment, and then the supportive environment when it's coming and dealing with patients with DM. Because everything we do is to build and prolong their quality of life and their life with you. And implementing and changing a few things or changing a lot, we can buy days, months of additional quality of life that you can have with your beloved pet companion.
Hey everybody, a common complaint that I see is hip issues in dogs. And this can range from hip dysplasia to hip arthritis to just an abnormal strain that can happen with exercise. One of the things that we have to identify when there's a joint injury in there, that there's a lot of muscles that cross that hip joint. And if the hip joint is injured, those muscles will tighten up. So a simple way to reduce some of that compression that's happening in the joint is actually releasing some of the tension on the muscles that cross the joint. In particular, the one group that I like using or doing a lot lot of work on are the adductor muscles, which are basically the groin muscles. So I find a lot of times these dogs that have hip issues that they're almost super tense. The tendons feel like they're guitar strings or pencils even, depending on the side of the dog, and it's really easy to release those. So if Bo cooperates with me, I'll get him to stand up here and I'll show you how I do this. So when we work this area, where we want to landmark is actually right on the inside here. And when they're weight bearing, I mean, Bo has a nice meaty area through here, but they're not too tendinous, they're not too tight, they're a nice relaxed tone, even while he's weight bearing. But what you can do is you can go in there and just hold a little bit of pressure on it. If it is tender, dogs that have lost some of the muscle mass in their quads and their hamstrings, you'll find that these adductors get quite tense. But when we work in there, we just want to hold light pressure, and remember, this is a very sensitive area, and you want to proceed with a little bit of caution when you go in there because your dog might get a little bit nervous. The other thing is there's a big artery that runs through there, and you don't want to put pressure on the artery, so if you feel it pulsating under your fingertips, stay off of that. Another thing you can do is actually move the dog's leg to lengthen the muscle at the same time. Now, I say move with some caution when you do this, because if your dog, and maybe check with your vet or your animal chiro, whoever you want to talk to about this, but say if your dog has really bad osteoarthritis or really bad hip dysplasia, this probably isn't the best thing to do with them by moving the hip laterally like this. So you just basically hold that. I'm gonna go in from the back side here. I find it easier to hold the stifle and just opening up that joint a little bit and releasing that muscle. So think of the movement that a male dog would do when they're urinating. This is the same motion you want to do with their hip, but remember, proceed with caution if your dog does suffer from bad hip arthritis or bad hip dysplasia. Hope that helps.
What is up, guys? Welcome back to the channel. I hope you guys are having an amazing day today. In today's video, I'm going to be talking about the best ways to exercise your dogs / puppies back hind leg muscles. All these exercises you can do right here in your home and around your neighborhood. But before we get started, you guys please hit that like button, as it really helps with the YouTube algorithm in helping other people see this video. So we'd really appreciate if you hit that like button right now. But let's just get straight into the exercises. Number one of the best ways to exercise your dog's hind leg muscles is actually by this exercise called sit and stand. And sit and stand is essentially what the name implies. You have your dog sit, stand up, sit, stand up, and do that repeatedly, and by doing it consistently, it will build slowly and gradually your dog's hind muscles. As you guys can see, Jackson is sitting and standing. I am using a treat to reward him every time he sits, so definitely try this out. Number two, another exercise that you could do is actually walking / jogging up a hill or an inclined surface. So a hill is a great way to exercise your dog's leg muscles, just because it forces your dog, obviously, to put a little bit more strain on the back legs, the hind muscles, when going up an incline as opposed to down or a flat surface. In addition to this, uneven surfaces actually help with your dog's ability to balance, and it also exercises different muscles within your dog's body just because the surface, again, isn't flat. Number three, another exercise that you could do right here at your home is actually by using a treat as a lure and putting it in front of your dog and standing above your dog, having your dog in between your legs, and then having them stand straight and still, and using the treat as a lure to go left and right from shoulder to shoulder. And eventually you not only want their nose to touch their shoulders, but also their hip too. And this especially helps in exercising their core muscles. So this here again helps with the core muscles here. So eventually, again, you want him to get, good boy, his nose to his back hip. Good boy. Good boy. Yep. Number four is walking backwards. So by using a treat, you would want.
Hi everyone, welcome back to the channel. Today we're diving into the potential reasons why your dog's leg may be shaking. You may have noticed your dog's leg shaking in the past and wondered what's going on. In this video, I will walk you through some of the things to look for to help you determine if this is from a mechanical injury or not. Before we dive in, Bo here wants to ask a quick favor, and that is to like and subscribe to the channel. as being a model dog is very difficult work. A dog's leg can shake for a variety of reasons, and it's not always a cause for concerns. Sometimes it's just a normal part of their behavior. However, when the shaking becomes excessive or accompanied by other symptoms, it's essential to get to the root of the problem or seek out help if you cannot. As mentioned earlier, we'll be focusing on mechanical problems and what you can look for at home. But since leg shaking can be caused by many different reasons, let's talk about some of those first. The most common reasons are the most benign, and that is if your dog is scared or cold. When a dog is exposed to a new environment, this may trigger anxiety and stress. Certain stressors may be obvious to us, but others like odors, we may not pick up on and could cause the dog to enter a state of distress. The other obvious reason is being cold. The body will shiver, repetitively contracting the skeletal muscle to increase the heat production in their body. This is typically more generalized or throughout the body and resolved when moving to warmer conditions. On the other side of the coin, we have to address the many neurological and systemic conditions that can cause shaking in your dog's leg. Often these will have other symptoms involved or changes in behavior that may be noticeable as well. In the scenarios where you feel like something is not adding up, it's best to make an appointment with your veterinarian and have a thorough neurological assessment completed and blood work done if they deem it necessary. Lastly, we can determine if the leg is shaking from more mechanical type injuries. This can include things like arthritis, joint injuries, and even muscle injuries. Often when a dog has an injury, they tend to hide it very well. This is because the dog has 4 limbs and they can easily shift their weight from the injured area to one of the other 3 limbs. So it may be difficult to pick up with an untrained eye. However, if you are noticing leg shaking, even if it is very subtle, here are a few things that you can look for on your dog. The first thing is to look for muscle atrophy or muscle wasting. Disuse atrophy is the most common cause, and this is typically because they're not weight bearing on that limb. As a result, the disuse of that limb will start causing wasting in the muscles. The best way you can look for this is looking side to side at each limb. So if we take the back legs, for example, we can look at the back of the legs and see if there's any asymmetry side to side. You may notice what's called scalloping in the muscles, where there's less thickness and less density in the muscles, or you might notice a little bit of twitching while you're holding on to it. The second item are changes to the gait pattern. So shaking may happen at rest. However, when you're looking for changes in their gait, this is while they're moving. So little subtle signs to look for are hopping and skipping. They may be subtle or sometimes they may be pretty obvious. But if they are more subtle, an area where to look for is when they're transitioning from either a trot into a canter or even a walk into a trot. They may have a skip in their stride, and this may alert you to what limb is causing the issue. Or they may have trouble when they're turning a corner, and you may notice that you're picking up on this skipping in one of their limbs. So the third way you can identify if it may be more of a mechanical injury causing the shaking is changes to their normal daily habits. So if it's front end shaking, you may notice that they're also hesitant to jump off of furniture or coming down the stairs. This is because it's putting more pressure in their front end and in their neck. So if there is an issue going on up there, typically they'll be hesitant because it might cause a little bit of discomfort. Well, if it's a back leg that's shaking, jumping up into a vehicle or up onto furniture or running up the stairs all may cause hesitation. So they may stare at you at the bottom of the stairs or at the vehicle, whatever it may be, and look for your assistance. But this is because it's probably causing a little bit of discomfort as well. And the last thing that you can do to help determine if it is from a mechanical injury or not is palpate that limb for tenderness. So if it is the front limb, for example, you want to palpate starting at the shoulder and all the associated joints with it. So ideally for this, instead of just checking the arm bones here and into the shoulder, we'd go all the way through the shoulder blade up to where it attaches to the spine, and then we'd work our way down. So you're really not going to be forcing a lot of pressure in there, but you do want to touch every tissue. So the bony tissue, the tendinous tissue, the muscular tissue, and then stress the joints a little bit too. And if the dog pulls away, tries to grab at you with their mouth, or yelps, then this is going to help to determine whether or not this is coming from a mechanical issue or not. So I hope this helps you determine whether or not your dog's leg shaking may be coming from something mechanical. If you're in doubt, it's always best to err on the side of caution and book a visit with your veterinarian to get the appropriate testing done.
cups of cooked brown rice. This could also be white rice. I'm just gonna stir this in.
The stakes are high here, people. The stakes are high.
I usually
Why?
put brown rice and just
Why?
put it up in the microwave.
I can't. Yeah. Hi, I'm Dr. Francis. I'm a world famous wildlife nutritionist. You may have not heard of me, but your guinea pig sure has. And today we're gonna do a review video for one of the most viewed YouTube homemade dog food recipes out there. Beep, beep, beep. That's supposed to be a guinea pig. Okay, so I looked on YouTube and I just Googled homemade dog food, and this is one of the top videos. So I'm gonna watch it now and see what food they're making.
Hello my friends, it's Danny, and today I'm showing you how to make homemade dog food. Our dog Charlie, he's 4 years old. We recently decided to switch him from store-bought foods to homemade food.
Okay.
And really, I
Good.
figured if everybody else in our house was eating clean and delicious, why not Charlie?
Good point.
Plus, I've really discovered that making homemade
If we're making food for ourselves, why not for the pet?
really easy to do. You have so many options, so many different varieties.
Yes.
So today what I'm going to show you
Great.
is a really great, well-balanced starter recipe that's both easy to make and super versatile. So the one thing I would suggest if you plan to start making homemade food for your dog food is to do a little research just so you know the foods that dogs are not supposed to eat. right?
Yes.
So there's foods like onions, garlic, kale, grape.
That is not true. Garlic is fine for your pets and kale is fine for your pets. I don't know where she got that list.
Raisins.
Yeah.
What I would recommend is doing a quick Google search to find an all-inclusive list of the foods they can't eat, and or to buy a few doggy cookbooks and do a little bit of research. I will be sure to leave the books that I purchased when I
Okay.
was researching this myself.
So another thing you can look at when you're trying to find recipes for homemade dog food is see if the recipe has been standardized following NRC, AAFCO, or FEDIAP requirements. Those are minimum nutrient requirements for pets that are scientifically proven, so that's kind of a good scientific backing to know that the recipe, you know, is good or not. Or maybe it was formulated by a PhD animal nutritionist or a veterinary nutritionist. I don't know about really anyone else.
In the description box below if you want to check them out. I also called the vet just to make sure that I had the green light and that I wasn't missing anything. So do anything that you feel you need to do to take the necessary precautions, but also keep in mind there's really not that much to worry about, and it's probably a lot easier than you think.
Okay. She checked with her vet. This recipe has been vet approved. Good for us to know. But then she says, don't worry about it. Not a lot can go wrong. That's not true at all. You could kill your pet. The stakes are high here, people. The stakes are high.
So to get started, I'm gonna heat a nice large saute pan
Okay.
over a medium heat.
So it's gonna be
Also
fried.
use a pot. Actually, if you're doubling or tripling the recipe, I recommend using
Food prep.
a pot.
Food prep is good.
And I'm gonna melt 1 tablespoon of coconut oil.
Coconut's fine.
Once the coconut oil has melted down, I'm adding in 1 pound of ground turkey.
Turkey is
This could also
great
be
protein.
ground beef, and I'm just gonna start breaking it up.
Yeah.
You just wanna break it up until you have crumbles, and let this cook for about 10 minutes or until it is cooked through and lightly brown.
Nothing wrong with that, but if you want to make it the best food possible, then actually you don't want it to be cooked through. Cooking it medium rare is actually the best thing because then there's only about 2 different digestibility between raw food or gently cooked. If you're fully cooked, you could be decreasing like a full 10% digestibility. But so far, I mean, still fine.
Next up, I'm gonna add the veggies. We're using about 3 cups total, starting with 1 cup of shredded zucchini, which is about 1 large zucchini. Then 1 cup of shredded carrots, which I washed and peeled. And then a big old handful of baby spinach,
not bad, but
which I
it's a
just
lot.
gave it really rough chop and cut it up nice and fine.
Just a rough
Now,
chop.
it is not recommended that you add salt to your dog's food,
True.
but there are lots of spices and herbs
Yeah.
that can be really beneficial to the dog.
Yes.
So I'm also gonna add in a half a teaspoon of turmeric because that's
Love turmeric.
anti-inflammatory.
Great
It's
for your
good
pet.
digestion.
Yes, girl.
Along with the tiniest pinch of black pepper.
Yes.
To help act activate that turmeric.
Yeah, she's right.
And we're just going to stir this all together.
Yeah.
Get all of the meat mixed up with the vegetables and let it cook for another 8 minutes or so. Really what we're looking for is for those veggies to become nice and tender. And because they're cut so small, it doesn't take much time at all.
Yeah.
Then I'm just gonna turn off the heat.
Yeah.
And I'm gonna crack 1 egg right into the pan.
Sure.
And the residual heat from the meat and the veggies is gonna cook
Eggs are
this
great.
egg. So I'm just gonna stir it in, get it really well incorporated. Not only is this gonna add extra flavor, but it's gonna add a little more protein, some healthy fats, and some great vitamins and minerals as well.
So the best way to actually cook eggs for your pets is you want to have a cooked egg white, but you want to have a raw yolk. That is the most digestible. That's almost 100% digestibility if you can do that. So when I was trying different ways to cook eggs at home for pets, poaching seems to be the best way, where the egg white is fully cooked and the yolk is still kind of runny. That seems to be the best way. What she's doing now is fine. It's still, great additions. It works. It's not the best, but it's still what most people do and very good for the dog and cat.
And then the final ingredient is 3 cups of cooked brown rice. This could also be white rice. I'm just gonna stir this in. You can make the rice however you prefer. I like to take a shortcut method. I usually use brown rice and just put it up in the microwave, and then I let it cool a bit and add it right
Microwave?
And you're gonna see that once everything comes together,
You're killing me.
you might even want to take a bite of it yourself, which would be totally fine because there's nothing in there that you can't eat. But what you want to let it do is
Nothing in there. It's rice.
before you serve it.
She's making fried rice for dogs.
Transfer it into an airtight container, and this will last in the fridge.
Oh my God, she's just missing sambal and it's like fried rice.
You could pop it in the freezer for up to 3 months. Now,
I don't understand. Why would you make a diet for your dog or cat made with fresh, whole foods and then put in as much carbs as you would find in a kibble? I don't understand. Wait, she's finished?
makes about 6 cups of food, which for Charlie,
There's nothing else?
45 pounds, is 3 days worth of food. So I do recommend, if you plan to start cooking for your dog on a regular.
I can't. What vet approved this? What vet approved this diet? She actually called a vet and they said, yeah, this is great for your dog. There is 0 calcium. There is no omega-3 fatty acids. There's not gonna be enough zinc, enough copper, not even enough iron in that. This diet is not okay. This diet doesn't follow any regulations. Whether you're talking about nutrient requirements or whether you're looking at prey model ratio, like this is, she checked with a vet and then she used dog cookbooks. This concerns me a lot by the information that is out there.
Basis, scale up the recipes so you don't have to be in the kitchen every 3 or 4 days, right? Make enough to get you through a week or.
Okay, yeah. It's not good. It's not good, everyone. I cannot sit here in good conscience and support this recipe. I'm sure that she had the best intentions, and of course her dog loves it and stuff, but for long-term health, I'm sorry, this diet is actually dangerous. No, that's just a no for me. It's a hard no.
Adding some fresh whole foods to the dog's food can be extremely beneficial for the dog.
Agreed.
Before we dove all the way in, oftentimes my husband would add a scrambled egg to Charlie's food, or he might add some shredded carrots or apple.
Good,
maybe
okay.
A little dollop of Greek yogurt, right? So you can kind
Greek
of
yogurt,
ease your
full
way
fat,
into the process.
plain.
Or even if you never plan on going all in, I am of course happy to share. And as always, thank you so much for watching.
Thank you so much. Okay, I'm concerned for this dog's health. I would like to know what's going on. This diet is not nutritionally complete. The ingredients were fine. I mean, it's gonna be very high in carb, which makes me question what the point is. But at the same time, because it's not nutritionally complete, this is the kind of snack or side dish that she could prepare and then mix with something that is fully complete, like mix this with kibbles. Then it definitely will increase the nutrient quality of the entire diet and of course the kibbles and stuff. But as the sole diet, this is significantly deficient. And I am concerned. And I had to hold in some bad words, but I didn't. Well, I hope you enjoyed this review of this interesting video. Please be a little bit more litigious when you are looking at YouTube dog recipes. As far as I'm concerned, if it's not put together by a PhD nutritionist or veterinary nutritionist, don't do it. Or mix it with something that is complete just to be sure. Or send it to me and I'll tell you what it is, because I am now concerned for 60% of all dogs on this planet. Hope you enjoyed the video. Comment below. I'm sorry if I sounded harsh, but this is just not okay. And I'm getting nightmares tonight. Like I need wine. I can't get over it. Have a great day, everyone.
Hey guys, on today's episode, I thought I would do something maybe a little bit different. I'm going to interview a veterinarian of another specialty away from mine, which is neurology. Today, I wanted to interview a veterinary nutritionist simply because I think a lot of people don't know the basics of what or how to feed their dog and what's a good idea and what's a bad idea, how to tell good food from bad food, safe food from unsafe food. And I thought nutrition in general was a good place to start with this video series. So on today's episode, I'm interviewing a veterinarian named Dr. Lindsay Bullen. She's a veterinary nutritionist based in North Carolina, and I think you guys will like this. So yeah, let's get started. So welcome, Dr. Lindsay Bullen. You are a board-certified veterinary nutritionist, rumor has it. And
rumor is correct.
Yeah, thank you very much for being on this maiden voyage of, I don't know what this is, video podcast. I don't know what you would even call it. It's just literally me trying to get some information for people and add value. So thank you for coming on my show. I guess I have a show now.
You would have a show.
Okay,
yes.
Okay. I guess I have a show. So,
well, thank you for having me. It is a pleasure to be here. I appreciate the invitation.
Yeah, no, thank you so much. You are being very generous with your time, and it's much appreciated. So I'm going to try to be as concise as I can because I know that you are a very busy person. I think the best first question for me to ask you is just the usual, what brought you to veterinary medicine? And then if you can also kind of expand upon what led to you becoming a veterinary nutritionist, because that's not a very common path. As a neurologist, I kind of have the same feeling for me too. A veterinary neurologist is not something that, people really think about growing up. But if you can kind of walk us through that path, and I think that's a good starting place to get an idea as far as where you come from.
Yeah, absolutely. So like most little girls, at some point I decided I wanted to be a vet from the time I was about 2, realized, I could help animals, really enjoy working with animals. And the thing that really drew me to veterinary medicine, which I think a lot of our colleagues would argue about, I really like working with people as well. So I have
that was like the opposite of me.
I know. Well, exactly. So like you, a lot of our colleagues get into veterinary medicine because they prefer to work with animals over people. I really enjoy communication and education, and working with the clients is a wonderful opportunity for that. Yeah. So what drew me to veterinary nutrition, I actually wanted to be a surgeon. My dad is a human surgeon. He's a general surgeon, and he's, in my opinion, a very, very good doctor, very good with the people, very good, skill-wise with his hands. I was able to watch him perform surgeries.
So not the stereotypical surgeon that we all talked about.
Not the stereotypical surgeon, exactly. He was one of a kind. I mean, even his nurses liked him.
Wow. Pretty rare.
Right? No, I'm just kidding. For all of you surgeons out there, just kidding. But no, he was a wonderful role model. And so I really wanted to get into surgery. But I also knew I wanted to have a family. My mother was a wonderful homemaker role model. And not that, you know, my surgery mentors where I went to vet school were bad. They were wonderful, but they were all men except for one. And I just, you know, most of their wives stayed at home with the kids, and I got to see how late they worked at night and decided that for me personally, that was not necessarily the life that I wanted. I didn't know how to balance having a family and also being a successful professional and surgeon. So I decided to go to general practice, and but wanted to get more education, so I signed up for an internship that focused on nutrition, and said, whoa, nutrition is super, super cool. Now, don't get me wrong, it is really hard to make basic nutrition sexy and exciting. And I also really hated basic nutrition. But once you get into the clinical application and figuring out that every single case is a puzzle, and again, that opportunity to collaborate with the client, to collaborate with experts like yourself, really for the betterment of the individual, and to truly tailor each individual plan, that just completely opened up this world for me. And so I decided to try to become a board certified nutritionist, and very grateful that it worked out.
Yeah. So at what point in your veterinary training, like, was this in vet school that you had an opportunity show itself like this?
Kind of, yeah. So I was really lucky. I came from one of the few vet schools that had a board certified nutritionist there, and a nutrition service. And the nutritionist took me under her wing, and, you know, again, the basic nutrition class was pretty boring. It was 8 a.m. I missed it a lot. But once I started taking some of the advanced nutrition electives, and I saw how really important metabolism in general is, and how something as simple as a different nutrient profile can alter metabolic expression and really treat the patient on a cellular level. And I love math because I'm a big dork, you know, so there's a lot of math involved with nutrition.
Yeah.
You know, it really kind of opened my eyes to it. And then after my internship, because I kind of thought about going on to general practice, I decided that I really wanted to focus on education and nutrition, and took a little bit of break between internship and residency, but came back for a nutrition residency and a postdoc, and then started my own service.
That's awesome.
So
no, that's really awesome. Do you think that you could have done, like, if you went the general practice route, do you think you could have provided the same service to people, or you would have just had like less formal knowledge about what you were doing?
That's an awesome question. You know, I hope that I would have taken the initiative to get extra training so I could provide this level of service.
Right.
I honestly don't know if I would have, with all of the, you know, really important things that general practitioners have to do on a daily basis.
Right.
You know, and so it's one of those things, like, my internship really helped hone those nutrition skills, and I think I would have been a much, you know, better, or at least better qualified, nutritionally speaking, general practitioner had I gone straight out from there. But even with the benefit of a board certified nutritionist in vet school, you know, I was sorely prepared to go out and provide accurate nutrition recommendations, better prepared than others, don't get me wrong.
Right.
But the information that we get in, you know, a single elective class, or even a single semester, really there's a lot more information out there regarding, you know, nutrition that really we need to be bringing to our veterinary students, and even to our continuing education opportunities.
Right. Yeah. I remember in school, the very first semester, we spent probably the most time doing gross anatomy and histopath.
Oh my God, exactly.
So
both of the classes I didn't excel at.
Yeah, like 3 to 4 month period doing that, and you could argue nutrition, just like every other major discipline, is just as important as that. And I got, I think, 2 weeks or 3 weeks.
Right.
Something along those lines.
And when you think about it, you know, both the American Animal Hospital Association, the World Small Animal Veterinary Association, like, name an association, doesn't matter, veterinary related, nutrition is considered to be the 5th vital assessment. So it is on par with temperature, pulse, respiration, pain score, and then you have nutrition. And it's one of the things that's forgotten most often, or overlooked, or ignored.
Yeah. So, all right, that's awesome. And then what, as far as your scope of practice now, what do you find yourself doing on a day-to-day basis? Like, what's your major role? Like, for me, it's like 50% epilepsy cases, and then another 50% either, you know, paraparetic, paraplegic dogs, or like chronic spinal pain, things of that nature.
Yeah,
so
absolutely.
What would that be like for you as a nutritionist on a day-to-day?
So I'm very, very lucky. I work in a high volume specialty practice with criticalists, anesthesiologists, like most of the specialties we have available, which is wonderful. So very, very, very spoiled, very lucky.
Yeah.
So the majority of my day, I would say probably 50 to 66% is dealing with our ICU patients.
Okay.
Every single ICU patient that comes into any of our 3 locations gets an official diet recommendation by me or one of my doctors.
Interesting. Okay.
So it's one of those things where we're like, in a healthy animal, poor nutrition in the short term, not that big a deal. In the critical care cases, it can be a very big deal.
Right.
So those are the ones we want to focus on the most, is the critical cases. So we have anywhere from 20 to 30 patients a day that we're providing complete dietary recommendations for in-hospital use. We look at all of the diagnostics that have been performed in-house to make sure that they're appropriate. And then the rest of our time is taking appointments for external cases, whether it is, just commercial feeding plans for an atopic dog, or as sometimes I do get the cognitive dysfunction, neurodevelopment type cases. It's not often, but we do get those.
Hey, he circled in the cage one time.
Exactly. He circled in the cage. I got to work on his brain. I'm like, all right.
Yeah.
Or, completing tailored homemade diet plans. We have a lot of people that started doing homemade diets during the pandemic because of diet shortages through no fault of the manufacturers. It was supply shortages, and then from the supply companies, they had COVID outbreaks. So it's just it's a really terrible thing.
Supply chain, just like everything else.
It just melted. Exactly.
Yeah.
So we have people trying to cook for their dogs because they can't find food.
Yep.
So we do a lot of tailored homemade diet plans, but the important thing is that me and my team, everything is tailored to the individual patient. So you might get patients that are on a similar type of plan because they have similar types of diseases, but we don't just pull from a recipe book. We don't just say, oh, you got kidney disease, have a kidney diet. We're very specific on what we recommend, and it's based on what is metabolically happening with each individual patient.
Interesting. And then there's another percentage where, or maybe there isn't, but how much is what you do people just like wanting maintenance care for their dog, like generally just like, hey, what should I feed my dog? Can you help guide me through a diet?
That's like 5%, I would say. So we do have, a mandatory appointment first, which we do offer video appointments or Skype appointments, that sort of thing, because we want to have that interpersonal relationship with our pet parents. But I had one yesterday, and the client just wanted to chat and say, you know what, there's a lot of crap out there.
Right.
What do I feed? And, we talked about her pet, we talked about her philosophies, what she knows. I shared, my knowledge with her, and she ended up deciding to do an official plan later. But we have patients and clients that just want to talk and make sure that they're on the right track. And, we definitely provide that too, but it is not the norm.
Yeah. Yeah. So it's mainly you're more or less treating disease like we do in your role. So one thing that I've noticed in researching like the role of a veterinary nutritionist, I see a lot of what's called like canine certified nutrition, or canine certified nutritionists, I think they're called. What is the difference between what you are and what a canine certified nutritionist is, and the roles and how they differ?
Yeah, that's an awesome question. So the truth is, I actually don't know what goes into being a canine certified nutrition
I don't
person. There's several quote unquote certifications out there for nutrition. Some of them are more reputable than others.
Okay.
So for example, I know that there is, I think it's a technician certification course that's put on by Kara Burns. She is a VTS in nutrition. And I think she might be the president or past president of VTSs in nutrition. And then she partnered with a board certified veterinary nutritionist to kind of create this course for education. So something like that, I would have way more clout than some of these other just like random online certifications if there's not somebody credentialed involved.
Right.
But to be a board certified veterinary nutritionist, you have to be a veterinarian, graduating with a 4-year degree.
Right.
You have to have undergone your internship and a 2 to 3 year residency, depending on where the location is. I believe that most of them are 2-year residencies. Most of us stay on additional years for postdocs, to get our credential packets in, and then you have to sit a very, very strenuous certifying exam, which I'm sure is similar to yours. We have 2 days of just testing.
As in it consumed my life for multiple years?
Oh, it consumes your life for forever.
Yeah.
And honestly, it has a very poor pass rate because it's very challenging.
Yeah.
So the thing that I try to share with my clients and colleagues that don't understand is that a lot of people think I'm a specialist in diets. That's like a minimal aspect of what we do. We're specialists in biochemistry and metabolism, and then we manifest our recommendations in the form of a diet or in the form of nutrient profiles. Whereas somebody who is a quote unquote nutrition person, and again, what they're able to do really depends on the credentials, might not have that degree of metabolic understanding. And the benefit of being a veterinarian on top of that is we understand how your treatments medically and surgically are going to affect the patient, and we can make sure that what we're recommending nutrition wise is synergistic and complements your therapies rather than fights against it, because there's a lot of stuff out there that can negatively impact what our colleagues are trying to accomplish medically and surgically. And again, we try to work as a team, and we have that basic understanding of disease pathophysiology, so we can really make those educated decisions.
So would you say, I mean, it's my impression that you would be a one-stop shop, like really, like you could handle any aspect of nutrition for a pet, whether it's maintenance and I just want what's best for my dog, to they have disease XYZ, what's the best thing to feed them and how?
Yeah, I absolutely. There are definitely colleagues of mine that prefer or focus on one, aspect or another. There are those that really enjoy gastroenterology and so would primarily focus on that. To my knowledge, I think I'm one of the few that is willing to tackle exotics and small mammals. I am not that's not my jam, but I'm willing to tackle it.
Right.
But theoretically, yes. I mean, our training encompasses, normal physiology from birth to weaning to growth to geriatric, like all the things, but it absolutely encompasses disease state as well. But I'll be honest, when I have a client that's like, there's nothing wrong with my cat, what do I feed? That's actually more challenging than when they have 20 problems. Because when you have 20 problems,
you have more options.
Yeah, exactly. Exactly.
Right. That's awesome. So what's like an example of a more common exotic animal?
I see ferrets. I get a lot of ferret questions. Yeah. And honestly, those are my preference. I've worked on a couple of hedgehogs. I have consulted with a couple of zoos for, possums and armadillos and things like that. I did a capuchin monkey one time. So again, not my jam. A lot of research goes into that, but I'm at least willing to try. So.
Gotcha.
As long as the client and the doctor understand that it's a little outside my wheelhouse, I am willing to try.
Yeah, I'll do an MRI on an exotic animal about once a year. It's kind of the frequency that I'm running at. All right, so I did want to ask you just in general, you kind of touched on it, kind of broached this topic, but like probably the most common question I get from friends and family and lay people is just, what should I be feeding my dog and my cat? Right. And like you said, it's like such an open-ended question that when you get those cases, it's almost more challenging than like the worst diabetic cat there is.
It really is.
So how would you answer that question, in 5 minutes or less, basically? When people go to a pet store, and I think they face the same challenges as people who are trying to eat healthy when they go to the grocery store, and they have no idea what to look at, what's good, what's bad, because there's so much. What do you look for? Like if you were to walk through a Petco or something along those lines, what are you looking for as far as like the good stuff and the bad stuff?
Sure. So I think one of the important things that I usually tell my clients in general, for the most part, it's not black and white, right? It's complicated. And so a lot of pet food companies, their marketing strategy rather is, this is good, this is bad. This is what we have, this is what we don't have. And that's just false advertising, and it makes things confusing. Yeah. If it's a toxin, yes, like that is bad and it shouldn't be in food. And there's regulations in place to hopefully ensure that doesn't happen. Right. But what I am looking for and what I try to educate my clients on is a product that is manufactured by a reputable company. So then the next question is, okay, what is a reputable company? How do you figure that out? Exactly. The Pet Nutrition Alliance is an amazing resource. I think it's petnutritionalliance.org, but if you literally Google Pet Nutrition Alliance, it pops up. And they did this study called Dare to Ask, where I think it was hundreds of different manufacturers. They reached out, they asked them a handful of questions. a lot of them didn't even respond, which that's step one. Like, are they even willing to get back to you if you have a concern or a question? If they're not, that is a waste of my time. You know, do they use contract manufacturers? Do they own their own facilities? In my opinion, if they own their own, it's easier to, you know, set quality control standards rather than using a third party, because then you're reliant on an additional party to be doing the right thing.
Sure.
You know,
It's like owning
are
a
there
house
new
versus renting a house.
Yeah, exactly, right. Are you know, are there nutritionists involved in the production? Are they physically on staff? You know, is there a designated nutrition team? That tells me that the company really is invested in the nutrition aspect and less in the marketing. Now, there are companies out there that don't even consult with a nutritionist. I'm like, I don't even know what you're doing. Like, who are you talking to? There are some that will independently consult, and I've done work like that in the past, where somebody's reached out to me, said, hey, can you help? And that's way better than nothing. But they're, you know, the companies that have a designated nutrition department with multiple credentialed people on there, so you get different points of view, different aspects. I love to see the combination of a PhD and a board certified nutritionist, because that veterinary nutritionist is going to have the medical aspect. The PhD might have more of that formulation aspect, and together, you know, they'll create this beautiful diet. And then, are they willing to be transparent? You know, if you call and say, I need the salt level because there's cerebral edema, and they're like, but that's proprietary. Okay, then you're not going to feed it, right? And so the Pet Nutrition Alliance makes it easy. You can just put in whatever brand and it'll give you the answers to those questions, which is awesome. But in general, my opinion, the more reputable companies are the ones that have been around the longest. They invest their finances in quality, peer-reviewed, and publicly available research. They do feeding trials. They have stringent quality control measures for the, you know, ingredients that are sourced and for their products as a whole. And the ones that come to mind are usually the ones that the clients are hesitant to use: Purina Hills and Royal Canin. But I compare it to Starbucks, right? Like, for the longest time, I tried to drink local coffee and support the local team, but the Starbucks coffee was just so much better, you know? And I was like, no, but there's a reason why they're a big brand. They did it right, right?
Yeah.
And the same thing for Purina Hills and Royal Canin. They've been around, they've invested in the research. They, you know, let the research be available. There's a diet out there that says it cures cancer, but they won't show me the data. You know, I'm not going to use it, like, because they're full of crap. So,
Why they confuse you about what to feed your pet. This is what you need to know. The whole what to feed your dog, what to feed your cat, it is just so darn confusing. Here's what I think. Pet food is a multi-billion-dollar industry. It is huge. When you're dealing with that kind of money, you can get a whole bunch of advisors, scientific experts saying, you got to be feeding X. It's got to be balanced. You got to make sure you're not missing nutrient XYZ, or gasp. Your dog, your cat, they're going to be ghastly ill. Some dogs, some cats, they can do pretty well on commercial pet food, but not all. There's a huge variation amongst our animals. Different dogs do well on different diets. Different cats do well on different diets. Like, more importantly, there's some simple basic principles that you can be following to ensure you're feeding your dog, you're feeding your cat as healthy as you can feed them. My last dog, Hoochie, he was this awesome mixed shepherd lab cross dog. First dog I ever had in practice. At the age of 8, he developed hemangiosarcoma. That's a cancer of the lining of the red blood cells. Developed this massive splenic tumor. It spread to other organs. Within 3 weeks after diagnosis, he died. This made me really wonder about the conventional veterinary dry kibble. Let's start out with some facts about conventional pet food. It started as a great way to get rid of waste products, things like udders, intestines, etc. that people wouldn't eat, stuck it into pet food. Disease, cancerous animals, that can be part of the human food supply system. Let's turn it into pet food. And even today, there are still some pet foods that have diseased, cancerous animal parts. Much of the commercial pet food is artificially preserved. We know some of those artificial preservatives, such as BHA, BHT, ethoxyquin, they've been linked to serious diseases such as cancer. Many of the pet food bags, they have this really shiny inside lining. Many of those are leaching a chemical called PFCs. Once again linked to serious disease in our animals. Clean Label Project, they looked at over 80 different types of foods, and they found multiple examples of contamination in pet food. They found some pet foods, they had over 200% more cadmium, a serious heavy metal linked to cancer, as compared to what was found in a cigarette. Lead, which is linked to serious disease, being a neurotoxin, they found many pet foods had almost 500% more lead as compared to cigarettes. BPA, that plastic toxin, has been linked to hormone disruptions. They found that many pet foods had almost 1,000% more BPA than was found in a can of chicken soup. And then a toxin that can kill you, arsenic. They found that some of the pet foods, it had almost 2,000% more arsenic than was found in cigarettes. Another study looked at ultra-processed pet food. Pet foods are into the things like kibble. They found that animals eating processed pet food had a 12% increased likelihood of developing cancer. Just knowing that, I see a direct correlation between my dog Hoochie developing hemangiosarcoma and the science diet stuff that I fed him. Why are they confusing you? Many people, many veterinarians, and they really are convinced that you need to be feeding your dog, you need to be feeding your cat a balanced diet. And if the diet isn't balanced, they're at risk of serious disease. And the big companies, they have a vested interest in you buying more of their commercial food. Here's kind of my way of feeding a bit of a balance of everything. I still do feed some kibble. I've been feeding her Acana. This is the red meat recipe. A couple times a week, I make her food at home. So here's a super simple recipe. 1/3 animal protein. This is ground turkey. I added in some sunflower oil. It's 1/3 healthy carb. We have sweet potato, then 1/3 veggies. I made up some peas. This would be a standard meal for a little 20-pound Tula. Got a half a cup of the ground turkey, half a cup of the sweet potato, half a cup of the peas, half a scoop of my Ultimate Canine. Then I'm just gonna mash up the peas, the sweet potato, and the Ultimate Canine Advance. Just gonna mix that into that ground turkey. Then last but not least, I've also been incorporating raw into Tula's diet. Standard amount is about 1 pound of food for 50 pounds of body weight fed daily. Tula's closer to 25 pounds. She needs about 1/2 pound of food a day. This defrosting chicken breast here, it's about 1/2 pound. And you love it. Oh, it's yummy. My general takeaway from the whole video, you don't need to be so concerned about making sure that it is complete and balanced. Really vary your dog, your cat's diet. Make some of their foods at home. Eating raw, maybe try the prepackaged frozen raw. It's an easy way to start.
Welcome to the Dr. Gundry podcast. Get a dog. It's my favorite prescription to give patients. In fact, just this week, I wrote another prescription to get a dog. Dogs are wonderful companions, offer unconditional love, and most importantly, they keep you active. But just like we humans, dogs and cats for that matter, I've had a cat too, are facing a major health crisis. Obesity and disease are rampant in our four-legged friends. And sadly, they are developing these issues younger and younger. But it doesn't have to be like this. Just like I say that certain lifestyle and food choices can prevent and reverse ailments in ourselves and our family members, you can do the same for your beloved pet, according to my guests today. They are Dr. Karen Shaw Becker, one of America's most respected veterinarians and breed-specific nutrition expert, and Rodney Habib, founder of Planet Paws, the world's largest pet health community on Facebook. Their new book, Forever Dog, Surprising New Science to Help Your Canine Companion Live Longer, Healthier, Younger, and Longer, reveals simple changes you can make in your dog's life to help them thrive and live to a healthy, ripe old age. And who doesn't want that for their pups, myself included? Welcome to the program, Dr. Becker and Rodney. It's good to see you both again. We had a great time talking about dog food in a way a while back. And as the owner of 4 dogs myself, I'm excited to have you on to discuss canine longevity. Let's jump right in. What motivated you two to write Forever Young, and can you talk about each of your contributions?
Well, first of all, thanks for having us. It's a treat to be on your podcast. And yes, I think it was about 4 years that you were on our podcast. And you, of course, made a great impression. We were discussing the DCM saga then. But it was actually then, Dr. Gundry, that we started, about 2018, that we started our passion about investigating these oldest dogs in the world. And we had heard about them for several years. We knew that there were some 29, 30-year-old dogs out there. And I'll just speak for myself. Rodney's obsession with the oldest dogs in the world allowed him to interview the owners of those amazing dogs. But for me, I am obsessed with longevity science. And because the top tier human longevity scientists are doing some pretty amazing research, my obsession and my drive for writing this book was going to those scientists to reverse engineer the oldest dogs in the world. So you can talk a little bit about your obsession with ancient dogs.
Yeah, and my obsession, of course, comes from the wanting of my dogs wanting to live forever. I mean, who doesn't want that, right? I mean, the travesty of them only being with us for like 1/7 of our life is the most heartbreaking statistic in the entire world. And Dr. Gundry, when we would start following the statistics, I mean, every decade, one of the biggest surveys to come out on dog health was showing a decline by 10% every decade. I mean, it's that in itself, if it doesn't, it's not a wake-up call for the world that, hey, we really need to start looking here at what's going on, was the ultimate driver for myself to sit down with these pet parents with these extraordinarily long-lived dogs. I'm talking dogs like not just 21, 22, 25, 26 from these owners we interviewed, but 30. As we know, the oldest long-lived dog, Maggie, which was a Kelpie from Australia. So what were these pet owners doing, either knowingly or unknowingly, that we could take to the, as Dr. Becker alluded to, some of the top longevity researchers in the world and say, hey, decode this for us, and let's break it all down into words and put it into a book so all of us as pet parents can use some of these tools to help extend the lifespan and health span of our pets.
All right, so what did dogs' lives and lifespan look like in ancient times compared to today? Do we have any idea?
Well, we definitely have clues. I mean, Odysseus, if you look back into the Odyssey, I think like one of the second oldest pieces of literature written. If you remember in the battle, Odysseus would get, I think it was on his boat, and he would travel, and I'm probably going to mutilate this, but he traveled across the ocean, I believe, for 10 years, came back, got lost, another 10 years, 20 years, he came back and he met his dog, Argos, after 20 years, which was the first clue to a 20-year-old lived dog. As we started to dig deeper and you would talk to veterinarians of the 70s, they would tell you, Michael Lappin, who's Dr. Michael Lappin, who's part of one of it's called the Canine Longevity Project, the Golden Retriever Project that the Morris Foundation put together. He would tell you that veterinarians of the 70s would tell you that the average Golden Retriever would live to be around 18 years old.
17, 18. Yeah.
That's not happening today. In fact, research today will show you that the average Golden Retriever, 8 or 9, if you're lucky. So that was the first aha moment for me. For you?
Well, and for me, it's being in practice for 20 years and seeing dogs degenerate when they're still young. Seeing animals, watching animals go through a degenerative process is a miserable thing, especially 2, 3, 4 years of age. So I knew that there was an issue, not just from the time that I graduated veterinary school, but I knew there was an issue in clinical practice. So both of us came together recognizing that pet owners will do anything to help their dogs live as long as possible, but they didn't have the tools. They don't have the research. They don't know what to turn. I don't know about you, but in veterinary school, we were not told, in my preventive medicine class, we weren't told how to prevent diabetes and how to prevent cancer and how to prevent heart disease and liver disease from occurring. We weren't taught anything about preventive medicine. So my clients wanted that. And I looked at Rodney several years ago and said, listen, we have to write this down in a book to be able to give people a blueprint or a resource guide to be able to get the job done.
Yeah, so it's interesting, not to change the subject, but I have third-year family medicine residents rotate through my clinic, and just finished a rotation yesterday, and this individual had never been taught that any preventative medicine did not we were looking at kidney function or heart function or bone health, and she said, well, everybody knows that as you get older, your kidneys deteriorate, and everybody knows as you get older, your bones deteriorate, and everybody knows that as you get older, your heart deteriorates. I said, well, gee, that's funny. That's not true. And she said, well, of course it's true. And I said, well, you're going to see in the next month that that's not true. And, she walked away going, holy cow, why wasn't I taught this? And I'm sure the veterinary school is exactly the same way.
And part of the frustration, because I practice just as you do, I practice proactive medicine. No one wants to watch their patients get sick and then try and reverse the process. It's common sense, but also incredibly worthwhile to prevent the body from breaking. And yet we, at medicine as a whole, we're still functioning off of a disease model, a reactive disease model. So we wait for the body to break and then we try and patch it back together. What we know in veterinary medicine is that dogs are breaking cellularly very, very young, 2-3 years of age. They already are showing signs of cellular degeneration. And that was pretty eye-opening to us. Some of these amazing longevity researchers are actually doing some genetic testing. They've swabbed some of these ancient dogs and they're trying to determine, is there a genetic subset that is allowing these dogs to live an extraordinarily long period of time? Are there environmental variables, which of course there are? Is it related to food or environment or nutrition? All those things play a part. But probably the biggest frustration is that we aren't taught as doctors, and then in turn teaching our clients, who then will be able to advocate for their patients, in this situation dogs, we're not teaching them strategies to prevent the body from breaking. And that was something that with all of the oldest lived dogs, their owners all had that piece of common sense in recognizing that they would do everything they can to prevent that from occurring.
Well,
it's a big difference in a mindset towards preventing disease.
And it's equally frustrating for the pet parent because, of course, logically, when we, if you're sitting on the other side of the screen and you're listening to proactive Dr. Gundry or proactive Dr. Karen Becker, it's frustrating as a pet parent when you go into the world looking for a proactive doctor. It's almost impossible. I'm sure, substantially harder in the vet space than it is in the human space. And so it's very frustrating, at times when you go in and you want to talk about food and you want to talk about, hey, I've been doing some research. I see a lot of these packaged food products, processed foods. Maybe these aren't the best things for my pet. Sadly, you're met on the other end with not much advice in return. You're usually sent home and told to either look up a manufacturer and read what maybe the process manufacturer is posting online, and that's where you're going to get your information. And sometimes that's not always the best information.
That's a really important point, Dr. Gundry. The big difference, I think, between veterinary medicine and human medicine is that veterinarians are still, sadly, the last remaining group of health and wellness professionals that advocate eating an entirely ultra-processed diet from birth till death. Veterinarians still advocate only eating ultra-refined foods. That's, I think, a core basic foundational problem when it comes to longevity is we're feeding dogs fast food and expecting them to thrive, and they're not. So that's kind of the conversation starter right there.
Well, yeah, and you have the fear of God put in you as a pet parent because you're told that processed food is science. It's scientifically formulated. It's put together, every single nutrient, every single chemical composition is put together to meet all the needs of your dog. And venturing into your refrigerator, pulling out a carrot, pulling out an apple and offering it to your pet will cause diarrhea, could potentially cause pancreatitis.
All of these
There's
fears.
arsenic in the seeds of apples and potentially could harm your dog. So stay away from those scary fresh foods. They're very dangerous, and just stick to processed food. It's science and it's safe. And man, my grandmother will tell you that that maybe is not the best advice in the world.
So let's talk about food. It's interesting, the commercial dog food industry has kept a lot of useful information from us, like you're implying. And yet, commercial dog food, I've looked back in the history of commercial dog food, and really the main thing was to make nice form poops that are easy to pick up and aren't very messy. And a scientist years ago figured out if you grind up a bunch of soybeans, that'll actually make a nicely formed poop and everybody will be happy. Correct me if I'm wrong, but I think that's where the first kibble came from. So I want a nice form poop out of my dog. And yet I want my dog to live a very long time. So help me out here.
So, first of all, you are absolutely correct. We feed Little Brown Crunchy Balls, the vast majority. In fact, we just read a stat this morning that still about 94%
Yeah, 94.
94% of dogs in North America still eating kibble, which is super convenient. No one's knocking that. You open the pantry, dump the kibble in the bowl, and you're done. Super convenient, no doubt. The question is, how is that making gut biome diversity? How are we nourishing an animal's gut? What exact nutrients are in that bag that are feeding cognitive well-being? How many amino acids coming from meat? Dogs are scavenging carnivores and cats are obligate carnivores. They need meat. When you do the carb equation on the average bag of dog food, they're eating anywhere between 30 and 60% starch. So the vast majority of calories are coming from refined carbs. So we have a biological appropriateness issue with the food that we're feeding. We have, certainly it's convenient, but other than sustaining life and meeting minimum vitamin mineral requirements from synthetic vitamins and minerals, we're not doing much besides sustaining life. And so when we open the conversation to, okay, well, what can we do? We have to start with, of course, the conversation about the gut. And if you've only ever fed your dog one food for 2.5 years, it's really important. Your dog's microbiome is incredibly narrow and incredibly unhealthy. And I will venture to go out on a limb and say that dogs only eating one food their entire life, they all have dysbiosis. They all have a very undiversified, unhealthy gut. And not suspiciously, one of the number one reasons we see dogs in veterinary medicine is GI problems. Everything from gastritis, enteritis, chronic colitis, IBS, IBD, pukey dogs, farty dogs, belchy dogs. It's just what we see. Out of that, then, we see a lot of skin conditions, a lot of chronic allergies, a lot of too many carbs are causing diabetes, and of course, excessive weight problems. All of these things are wrapped up in the fact that we're feeding this one monotonous diet all along. So there is a stepwise process, and that's one of the things that we work really hard in the book in terms of dispelling these myths. You don't just up and decide to change foods tomorrow, but you can begin diversifying your dog's gut with fresh foods from your fridge in very small amounts. And of course, you use poop as the barometer of how fast or slow you should begin introducing these new goodies to help diversify the microbiome.
I mean, the ultimate question is, and what everyone will ask, whether human world or in dog world, what is the best food to eat? What is the best diet to eat, right? And I mean, we're finding out more and more, especially when it comes to nutrition, that there's sort of tailored packages for the individual. Yes, everybody wants to see a great poop. And for us, when we started to travel out, we started to ask these hard questions, Dr. Gundry, to some of these experts. First, when you look at the oldest lived dogs in the world, that's the first place that one should probably start. You got a 30-year-old dog, you have a 27-year-old dog, Bushki from Hungary, you have a 25-year-old dog in the United Kingdom named Bramble, and you have a whole bunch of 20-year-old dogs in the United States. What were these owners feeding? And straight across the board, it was very evident that these owners were feeding a lot of fresh, whole, live foods. There may have been some processed food in those diets, but there was at least a 50-50 blend of fresh, whole, live food. So in a black and white inversion, you have your fresh and you have your processed. But that's not going to hold very well with the scientists. So then we went to talk to the top microbiologists. We went to San Diego, where we sat with Dr. Holly Gantz, who's a PhD microbial ecologist. And they will tell you, those microbiologists, without the shadow of a doubt, if you look inside the GI system of a pet, and a lot of people are aware today that diversity in the gut biome is very important, that hands down, these microbiologists can look inside the gut and they can tell you exactly which dogs have been eating fresh, whole, live foods and which dogs have been eating processed foods. It's very evident that the ones that are eating fresh foods have a more diverse, healthier GI system, according to these.
And then when we sat with, yeah, for sure. Then when we sat with Dr. Tim Spector of King's College, one of the most cited microbiologists, does a lot of work with the microbiome.
He's a colleague of mine.
He's amazing. And what he said to us was, I can't think of a worse decision for any mammal on the planet than feeding the exact same diet over and over for weeks to months. And he said, that's what we do for dogs and cats. He said, of course you'll have gut issues, but the gut issues are just the tip of the iceberg. That in turn is going to set them up for rapid aging. He said, then let's look at the quality of that monotonous diet coming in to the dogs and cats. It's full of glyphosate. It's full of mycotoxins. You know, the feed versus food issue, animal feeds are not approved for human consumption. So unless your dog food is labeled made with human grade ingredients, and it's going to be at least $120 a bag, the most expensive foods on the market, because they are human grade, you're feeding feed grade materials, which means we have a heavy metal issue, we have a glyphosate issue, we have a advanced glycation end product issue, and advanced lipoxidation end product issue. So I don't know if you talk about this a lot in your podcast, but I'm assuming you have, Dr. Gundry. When you high heat process food, once some bad things happen. Kibble has been high heat processed 4 times. So on top of the vitamins and minerals being, especially the vitamins being knocked down, the amino acids being compromised, the fats being rancid, we also have these unwanted tag-alongs in every bag of highly refined kibble and canned food that creates damage in the body. And so Dr. Tim Spector said to us, I don't know how you would ever expect to intentionally create health feeding these diets. He said it's not compatible. So part of what we took a lot of time in the book is how to rebuild the microbiome, how to fortify a resilient gut, how to slowly improve your dog's GI defenses by switching from ultra processed food to processed food to minimally processed food to fresher food to fresh food. And that doesn't mean you have to feed raw food, but we do want to think about how many times the foods that we're feeding our dogs have been high heat processed. We want to think about the quality of the raw materials in that food, and we want to think about where the nutrients are coming from. Are they coming from synthetic feed grade vitamins and minerals, or are they coming from real, live, whole, beautiful food that has nutrients that can be passed up the food chain?
So I could tell you so many stories about my dogs turning around a health issue with raw food, and I've actually written about them in my books, and I maybe won't bore you now, but raw is probably best, but what if you don't have the time or money to feed your dog raw? Because quite frankly, raw food costs a lot of money. So what do you do? What's the second best option, or can we meet in the middle somewhere?
You bet.
That's a great question. And so it was very important for us to be able to address that question. I mean, data came out for 2021 showing that the average pet owner in America is spending a little under $23 a month on pet food. And as you know, as you feed your dogs raw food, it's virtually almost impossible to feed a pack of dogs or however many dogs you may have for that budget. So we took on the challenging task of, all right, how do we start this pyramid of good, better, best, if you may? Now, processing techniques is important. So one of the things that we wanted to break down for the pet parent was, let's say that you're going into your local pet specialty shop and you're looking at a vast array of all of these foods and you have no idea where to start. Let's just start by educating you on processing techniques. The more heat that's going to be applied to those foods, the more synthetic vitamins and minerals you're going to need in there. Now, that may not seem like a big deal, but take into effect that every decade, thousands upon thousands of dogs in America will lose their lives to some sort of recall because either a machine went off kilter and sprayed too much of a synthetic in food. We know that I believe in 2019, Science Diet, one of the biggest food formulators in America, had too much vitamin D injected into the foods, which hurt a lot of animals. So it's very important that when you know that synthetics potentially can go off kilter in food, maybe steering up higher up the food chain with less synthetics in the food might be a great way to go. So we'll show you and guide you along the ways of different types of subcategories of foods that have less heat, of course, raw being the least. And as you start to go down that chain, of course, price starts to eventually drop. But let's just say for a second that you have no money. What can you do? Let's say that you're stuck feeding processed food, kibbles and pellets, and you're just on a budget. Well, one of the most fascinating things that we fell in love with was a study that came out of Purdue University that showed if you went to your refrigerator, and let's say that you were chopping up a salad for your family, and you had the ends of your carrots that you were not going to eat, the ends of your celery that you were not going to eat, a little bit of kale that might not look, let's say it's a little soggy, right?
A dented blueberry.
A dented blueberry.
Who likes squishy blueberries? No one.
Purdue,
but your dog does.
Absolutely. Purdue University funded a study to show on Scottish Terriers that dogs, who are also prone to bladder cancer, by the way, dogs that were fed these vegetables, green leafy vegetables, orange vegetables, 3 times a week, saw anywhere between a 70 to 90% reduction in the development of bladder cancer. So if you have no money, you can still use some of these odds and ends in your refrigerator that you could add if you can't afford raw food. That could help substantially.
Well, and it's a lot like the healthy food crisis we have in North America. It is way cheaper to feed your kids through the dollar menu, which is appalling. You go to Whole Foods and buy organic fruits and vegetables, it is no joke expensive. It's way cheaper to buy terrible food that your kids aren't going to fight about eating because it tastes amazing. No one's going to argue that. Here's the difference. If we do feed our kids or our bodies, the average person in North America, about 50% of their daily calories are taken in the form of processed foods. 85% of dogs in North America only consume 100% of their calories coming from processed foods. They never get any fresh living whole food. So even if we're occasionally eating crappy foods ourselves, we don't do it every day, all day for every meal, but we do it for our dogs. So yes, share all the fresh foods from your fridge that you possibly can. That's going to put into your dog's body fresh living whole foods. But if you can move from, let's say, extruded dry kibble to an air dried kibble, that is less heat, to maybe a dehydrated dog food or a freeze dried food where it's just cold, that is a whole lot better. I mean, homemade diets are actually the cheapest way to feed your dogs, but it takes a ton of work. It's like cooking for yourself. And you got to follow a recipe to make sure you're doing it right. So you can offset perfection, like the foods that you wish you could feed. Everyone probably wants to feed an all raw, organic, species appropriate, free range, ethically sourced diet. But if you can't do that, there's a lot you can add in with goodies from your own fridge to offset the amount of processing in the dog food.
But to talk about the power of the teaspoon, Dr. Gundry, so to go back to your original question is, what if you can't afford to feed maybe all raw? Well, what if you can do a couple of teaspoons of raw? This is where we traveled to Finland, where we sat down with Dr. Ina Hjelm Bjorgman, veterinary scientists, who were doing studies on, well, what if you took raw food? What if you took 20% of your bowl out of your ultra-processed diet, kibble, and you were to put raw food in there, just 20%? Would there be effect? They measured disease markers like homocysteine and methionine, and they saw a drop in disease markers just starting at 20%.
A massive drop, like 300% drop in inflammatory markers by putting 20% fresh food into a bowl of kibble.
Which I think at the end of the day would maybe up your food budget by, let's say, 25 to 50 cents a day. So maybe you might sacrifice on that extra large coffee, maybe bring it down to a large for your dog. You'll see benefits.
A large coffee for your dog?
A large coffee for yourself.
Yes.
Bring down to a large. Sorry. Yes. Don't give coffee to your dogs. Although I'm sure Dave Asprey would argue that there has been. You know, it's funny. Off topic. Jake Perry, who set the Guinness World Book of Records twice for the 2 oldest lived cats in the world, knew that there was something to coffee. We're not recommending it.
This is not a very
And he didn't know about mTOR suppression. But he set the Guinness World Book of Records twice with a 38 and a 34-year-old cat eye dropping coffee. Not recommended, but there is something
But every
to
day he gave a little eyedropper. He gave coffee in the morning, Dr. Gundry, and a little dropper of wine at night. I do not recommend this. However, it is interesting that he had 2 ancient cats drinking coffee and wine. Not recommended, but just throw it out there. You know, now's a chance we can talk about resveratrol.
Yeah, well, in my upcoming book, Unlocking the Keto Code, you're actually going to find out why coffee and red wine are such life-extending things. Yes. So there you go. Okay, speaking of life extension, one of the things that I really liked seeing in your book that I've been preaching now for over 20 years is intermittent fasting. But I think you guys are the first to say we ought to intermittent fast our dogs. That really goes against most common sense and veterinary advice. And so teach us about that. people were going, are you kidding? How cruel it is to, make my dog, time restrict eating. My dog has to eat 2 meals a day, and everybody knows that's what dogs do. So teach us about this.
Well, let me start by saying that before I was a veterinarian, I was a wildlife biologist. And as a wildlife biologist, I was trained to recognize that wolves, wild dogs, dingoes, jackals, hyenas, they're all evolutionarily adapted for fasting. Wolves and coyotes, they don't catch a rabbit at exactly 7:30 in the morning and 5:30 at night every day. They just don't. So their physiology has built in very natural mechanisms to adapt for not catching food that day. No problem. We have to remember that dogs and wolves are so close, they are not the same. But they're so close genetically that they actually can interbreed, and that dogs, up until 100 years ago, when the very first bag of dog food hit the market, dogs living on farms were hunting some. They were eating, whatever Farmer Joe threw to them. They were scavenging. They were probably eating a lot of garbage. They're doing some hunting, but there again, they didn't have a schedule of food. Dogs have thrived for thousands of years on cyclical eating patterns that didn't have an exact clock associated with them. So when we interviewed Dr. Sachin Panda at the Salk Institute about circadian rhythm in dogs, his statement was, no dog would ever eat when, they're not going to be hunting at 2 o'clock in the morning. They're going to eat if they're successful in a hunt. They're going to eat, they're going to gorge, eat a large amount of calories, and then they're going to fast. They're not going to continue eating breakfast, lunch, and dinner repeatedly. They're going to be a period of rest and digest, and then gorge, and then eat a large meal, and then fast. What we have seen metabolically on the researchers we've talked to, but also when we interviewed the great folks at Keto Pet Sanctuary, is that there's some real magic that happens in the body during this fasting period that you, of course, know all about. But that's the only time that a dog's body can rest, repair, restore, is in between meals. The problem is, well-loved dogs around the world eat like well-loved owners feed them, which means they have breakfast, then they have brunch, then they have a bunch of snacks before lunch, then they have lunch, then they have a 1:30 snack, and then they have a 3:30 snack, and then they have dinner, then they have after dinner dessert, and then they have a bedtime snack. They're literally consuming calories 10 to 12 hours a day, and that means they are secreting insulin 10 to 12 hours a day. And therein lies part of the issue with the chronic decline of animals' health, is that we're overfeeding them. They're being undernourished, but they're in a constant cycle of cortisol release and insulin release.
And here's what's interesting, whether a pet parent realizes or not, their veterinarian technically does tell them to fast their pet when their pet is sick. You'll always get a call, when you make that call to your vet, that emergency call, oh my gosh, my dog's got diarrhea. Typically the vet on the other end will be like, hey, fast them for 24 hours.
Water. When we say fast, always fresh, clean water available.
And typically magic happens within those 24 hours. All of a sudden, miraculously, that dog seems to get better. Now, this is real interesting too, because when we sat down with Dr. Jason Fung here from Toronto, nephrologist, he was telling us, the average human is putting food in their mouth 10 times a day, not 3 times. We think about 3 meals a day, but they're putting around 10 different types of foods. They go to the refrigerator, they're snacking. Oh, and by the way, they're sharing those treats with their pets. So as Dr. Karen Becker alluded to, dogs are eating almost 10 times a day, and every single time you're getting glucose spike, you're getting insulin release, and things are happening in the body that I believe that not a lot of pet parents are aware of. Now, fasting is challenging because I can, in my retrospect, speaking on behalf of a pet parent, yeah, you do kind of feel awful looking at those adorable eyes and saying, oh gosh, I'm not going to give you any food today because I love you. It's not an easy thing to do. So we try to break it down into stages. There is a ton of research out there that shows the magic of autophagy and what happens when there's not food in the belly. And believe it or not, if you've got a dog in a cancer situation, Dr. Becker mentioned we went to Keto Pets, where we sat with Dr. Dominic D'Agostino and the whole team down there, where they were able to, if not halt, reverse, or slow down these cancers, of course, putting these animals into a ketogenic diet. I'm very excited for your book that's on the way. But the benefits as well of what happens when food's not going into the body and how they're able to slow down the cancer process. So this is something that if a piano's not falling from the sky and you're not in an emergency situation as a pet parent, you're not really listening to fasting your pet. But one thing that was really impactful for us was one of the well-known longevity studies in the dog world that they use in the human space today, by the way. This was a controlled study over 12 years on golden retrievers, where they were like, well, what would happen if we fed dogs ad libitum, meaning how most pet parents feed their pets. You pour a bowl of kibble out for the dog and you leave it out for the whole day, and whatever Rover wants to eat, he's gonna eat. But what would happen if we were to take 25% of that bowl and reduce it over a dog's lifetime? Would there be some sort of impact? You said it to me yourself years ago when you were on my podcast, which was so impactful to me. You said, I remember, and I'm going to paraphrase here, but I believe, if I'm not mistaken, either it was your father or cardiologists would say that you have only so many heartbeats until your heart stops. And you took it and reversed it and said you only have so many calories you can use up until you reach that maximum threshold. So if you only have, like, let's say hypothetically 1 million calories in your lifetime, you can get there fast, eat them all at once, or you can slow roll it and live as long as possible. Well, this holds true for these dogs. These dogs, Dr. Gundry, that got 25% less calories a day over that 12-year study, on average, lived anywhere between 1.5 years to 2 years longer, just because they reduced 25% of those calories from the bowl.
So what we advocate is not that you skip a day of feeding, although dogs do fine. And if your dog is under 5 pounds, feed them every day. But dogs over 5 pounds, I have a 10-pound Doxy. I fed him once a day his whole life. He lived to be ancient and 0 health problems. But that being said, we do advocate feeding your dog every day, because who wants to fast their dogs? Who wants to fast themselves? No one. But what we do advocate is that you create an eating window. And by you creating an eating window for your animal, let's just say that you work all day, your dog's you're not going to be around your dog who's constantly saying, hey, you're kind of by the fridge. What do yeah, exactly. So that is a built-in fast. So if you are working from home and if your dog is a breakfast eater, get up and feed him breakfast. But the time that you start that first meal that goes in, try and get all your dog's calories in an 8-hour window. And by doing that, you're giving the body the remaining time in a 24-hour period for rest, repair, and restoration, for autophagy to occur, to all of the magic to occur in the body that needs to happen to reduce cellular aging. So let's just say that your dog is not a breakfast eater, and many dogs aren't. I have to say, as a veterinarian, one of the biggest questions I get from clients are saying, I get up in the morning and I want to eat breakfast, but my dog isn't hungry. So I add mozzarella cheese on the top of my dog's food. They start doctoring up their dog's bowl, big bacon. They want their dogs to eat a big breakfast. Well, if you think about it, dogs being Canis lupus familiaris, they would hunt once later in the day. They're not big breakfast eaters. So if your dog says, hey, I don't want to eat breakfast, awesome. Honor your dog's physiology. If your dog comes to you at noon and says, I'd like my first meal at noon, great. Then that's the beginning of your dog's eating window. And then if you can get that second meal, if you're going to feed twice a day, then get that second meal in within 8 hours so that you can provide this other opportunity for your dog's body to reset itself metabolically.
That's a good point. And again, we have 4 dogs and 3 Labradoodles and a rescue miniature poodle. We always have one rescue dog, and that's another story. But we have one of the Labradoodles, the mid-size. She is totally uninterested in breakfast. Everybody else thinks breakfast is a great idea. And she says, no, not interested, and we just, and she never eats it. So, but we still put it out because she likes to growl at everybody else. But she won't eat it, and and she's pretty smart. We'll see how long she lives. Our last rescue dog, we actually had to put down at 19, but he lived most of his life on the streets in LA, and he came to us about 6 years ago, and kind of on his last legs, but really skinny. And one of the things that's interesting, I think he actually had some good, long-term tactics, because, he made it 19 years, and we really thought, well, we're just going to nurse him through his last year of life, and he lived another 6 years with us. So anyhow, so yeah, dogs are pretty smart if we'd let them do what they want to do rather than
Right.
And rather than, so what do you, what do you think about all these dog treats and dog cookies and all these, yummy little things, and we're pampering our pet by doing that?
So that is the perfect opportunity to ditch those high carb, totally unnecessary. They're full of dyes and preservatives. They're full of synthetics that are just unnecessary, flavor enhancers. They literally do nothing for your dog nutritionally, and they take your dog metabolically back a step. So even Dr. Gundry, and they're super expensive. Treats are some of the most expensive food products on the market. So even, let's just say that you can only feed ultra-processed kibble because of a financial reason. Don't spend money on crappy dog treats, nothing from the supermarket. That's the opportunity to save some money and then feed your dog from the fridge. Feed fresh, whole, living, low glycemic veggies. Blueberries. The only foods you can't feed dogs, no members of the onion family, no grapes or raisins, no macadamia nuts because they're high in fat and they can cause some GI upset, no chocolate. But otherwise, from your fridge, if your dog will eat celery, feed it. If your dog will eat green beans, feed it. If your dog will eat lettuce, feed it. And that's a great way to save a ton of money from expensive treats that do nothing metabolically for your dog. In fact, if anything, they create a burden, a metabolic burden for your dog. Get those treats out of the house and start using real fresh foods as treats.
I can say, Dr. Gundry, when, the first thing, it's kind of a knee-jerk reaction for me when you say to me, hey, like, what do you think about these treats? That being because I'm a pet parent whose pet was severely injured and hurt from consuming treats. Yeah. The treat world is a very finicky, unregulated space. It was very important to us because of my dog Sam, and I had her kidneys damaged in 2008. I was feeding her those chicken jerky strips that were making waves and hitting the media like in the early part and the later part of the 2000s. Everybody wanted to feed chicken jerky strips at that time. And sourcing was a huge issue because you could bring in things from foreign countries and package them into your home country where you live and say that they were made or packaged in that country. And a lot of things were coming in from China at the time. I know that still today, the FDA, with a 15-year investigation, still hasn't been able to figure out what's going on with some of these treats. But that being said, it was very important to us to put into our book a guide of some of the things that you need to look for that can be potentially very harmful to your pet that are currently put in treats. A lot of whitening products, for instance, the Environmental Working Group just posted that titanium dioxide is maybe not the greatest thing in the world that humans should be putting in their body. I know in children's food, like, packaged candies and so on and so forth, this whitener is used, and new research is showing that it can actually mutate DNA. Well, these whiteners, like titanium dioxide, are in almost every single pet treat.
Everything. It's
because
in rawhides,
yes,
dental gels, veterinary prescription diets. It's in everything.
Remember, these treats are made to appeal to you, not so much your pet, because you're buying it. So if it looks delicious to you, if you buy a treat that looks like bacon, it's bacon flavored, but there's no indication of bacon in the treat. You've got to be careful and ask questions, because these treat companies will work with a lot of chemical companies and use things like cadaverine and putrescine, these scent-enhanced products that when your pet smells it,
they're addictive.
They're in, right?
Addictive.
Like, you could try making it yourself and not use these chemicals, and your dog will be like, are you crazy? Do you actually think I'm going to eat that? But you start using flavor enhancers and scent enhancers, you're going to change your dog's mind. And reading some of these dyes and artificial flavors, so that is really important to us, that we want pet parents to be aware of what they're looking at when they're looking on the back of packagings. And the power, as Dr. Karen Becker alluded to, they're just pulling a blueberry out of your refrigerator. There's dog studies that show that blueberries, what they can do, the free radicals, the antioxidants can clean up the free radicals in the body. They've done multiple studies on blueberries. And we know today that blueberries are a longevity food. You talk to almost any longevity expert and they're like on the top of the list to be adding. So what better way to pull out like a blueberry, freeze it in the refrigerator, the freezer, now you have a crunchy treat for your dog, versus using something with a whole bunch of additives and fillers and colors.
Things like sardines packed in water. Like how about some boiled eggs? Like, eggs are the best treat. They're cheap, they're amazing, they're clean, there's no added dyes, there's nothing. Dogs love eggs. So there's some easy, simple things right in your fridge that can completely replace those ultra processed treats that do nothing for your dog, and they're incredibly expensive, and you end up paying to give your dog health conditions that you have to then pay your veterinarian to try and fix. So you're better off just feeding clean foods, clean treats to the best of your
One
ability.
last thing that we'll add, Dr. Gundry, is there's some incredible pet parents, small farmers who have like small farms, or people at the farmers market that are actually doing some incredible
They
things
are.
because they want to avoid these type of synthetics and dyes.
If you have a local farmers market and they're making homemade chicken jerky, or you can buy chicken breast and chop it up and you can just give cube chicken, fantastic. So there are some amazing treats made with human grade ingredients that are single ingredient. You flip over the back and it just says rabbit meat or lamb lung or venison liver. Those are excellent single ingredient, high protein. As long as you can pronounce everything on the label, you know what it does or what it means, and you know source of origin in terms of where it came from, you're okay in feeding those treats. They're just really expensive.
Yeah. Another thing that you guys haven't mentioned that I'm a monster fan of, I actually give my dogs olive oil on their food.
Oh.
High polyphenol olive oil, and they love it. So
I will say this. First of all, as a Mediterranean, it's a staple in my household. I mean, what an incredible way for polyphenols. I mean, unbelievable. In fact, correct me if I'm wrong, is there not melatonin as well that can be found in
I'm
olive oil?
glad you mentioned that. Actually, there is, and I talk about this in The Energy Paradox and also in the upcoming book. It turns out that probably the true benefit of the Mediterranean diet has nothing to do with polyphenols or resveratrol in red wine, but olive oil and red wine have very high amounts of melatonin. And melatonin is actually one of only 2 antioxidants in mitochondria. There are only 2 mitochondrial antioxidants, melatonin and glutathione. And none of the other ones, believe it or not, are antioxidants in mitochondria. So yeah.
So Dr. Gundry, are you a proponent of mushrooms for glutathione, or what is your?
Believe it or not,
because
mushrooms are one of the second highest sources of melatonin.
I did not know
There you go.
that. So we're big fans of culinary and medicinal mushrooms for dogs. They're fantastic. They build the microbiome, prebiotic fiber, a bunch of really great things come out of mushrooms. People don't like to feed them. They're weirded out. People are weirded out by mushrooms.
Mycophobia, it's a really big problem. But to go back very quickly to olive oil, so of course we have so many references in this book, Dr. Gundry. I mean, well over, I'm going to say probably at this point, 400 studies. We couldn't fit them all in the book because the book would have cost $7 million. So we had to remove it and bring them into a website. But I was dying to get some data on olive oil. Would you believe there's not a single study done in the dog world with olive oil? I scoured the journals dying because I know that there's going to have to be a ton of benefit there. So hopefully some young scientist is listening to this today and says, I have a great idea.
Yeah.
But I do believe that olive oil is magical, and I'm sure studies will show the same thing.
And I'm a huge fan of olive leaf.
Yes.
As a proactive wellness doctor, I use olive leaf daily. So we're big fans of all things olive oil, olive leaf. But we have to remember too and excellent ads. We know clinically that it does a bunch of amazing things, but there's not studies to back it up yet. We're working on that. Yeah.
And interestingly enough, there are far more polyphenols in the leaves of fruits than there are in the fruits. So you're right, olive leaf extract has far more polyphenols than olive oil, and so on down the line. In fact, there's far more polyphenols in apple leaves than there are in apples. And there's far more polyphenols in blueberry leaves than there are in blueberries. So if you want to grind up some blueberry leaves, give those to your dog. But I digress. Okay. It's interesting. You mentioned that you probably killed one of your dog's kidneys with these chicken jerky treats. And I did the same thing with one of my Yorkies a number of years ago. And she was dying of kidney failure, and took her to the vet, and the vet said, well, take her home to die, and it was these chicken treats from China. And the good news is, and I wrote about this, I put her on the raw pancetta diet. I went and just bought raw pancetta, and literally that's all she ate. Her kidneys reversed, her edema went away, she had ascites in her belly, and she rejoined the pack and lived another 3 years after being sent home to die.
Wow.
But yeah, I did a good job of killing her kidneys, inadvertently, of course.
Well, let me say this, because first of all, you're unbelievable for taking the nutrition into your own hands. That's the scariest thing as a pet parent in the world. You know, I unfortunately, at that point in my career, I didn't know enough. And when you're a pet parent and you don't know what to do, it is the scariest feeling in the world, because when somebody tells you kidney disease or your dog's in kidney failure, in fact, my dog, over 25% of her kidney was damaged because of those treats. I didn't know what to do, Dr. Gundry. And so kudos to you for taking the diet into your own hands. Once I learned that I could take the diet into my own hands, I reversed the prognosis of my dog that was given 6 months. In fact, I had her scheduled for euthanization because they told me it was the humane thing to do. That was enough to light a fire under my butt to get me to start researching and say, hey man, I can actually take this diet into my own hands and control, you know, the creatinine levels, the phosphorus levels, the things that are happening inside my dog's kidneys. And, you know, that's kind of...
That was the beginning of you home preparing food.
Yeah, that was the exact beginning for me to home preparing food, right? And that's kind of like, that's always been the biggest driver for us, you know, wanting to sit down with scientists and then relay that information back to pet parents, just to empower them. Because when you have that ability, nothing is better when you need to pull the emergency cord one day if something happens to your pet and you say, I got a plan.
Yeah, I think that the biggest frustration for dog owners worldwide is they want to do intentional things to help extend lifespan and to keep health span really excellent. They want to do these things. They just don't know what to do. Where's the information? Where's the research? That is exactly why we wrote this book, is people want to know what to do. They just don't have a blueprint. So I think the feeling of converting confusion to clarity is the most peaceful and important thing that can happen to a pet parent, is that you're able to get clarity on what to do, the decisions you're going to make, and the path you're going to take, because you have a plan. And the only time you can make a plan is when you have resources to know what's going on.
Yeah, you know, we could go on, and unfortunately for today, we can't go on much longer. But you know, I think the important part of your book and what you guys have been doing really as a life work is so important for people to realize that just like in human health, what we've assumed is just kind of an inevitable process of kind of slowly dying and bad things happening to us is actually fixable and reversible. And the same thing can happen with our dog. And so many of us, and so many of our vets, have not been properly trained to help us in these areas. And it's not the vet's fault, it's how they've been educated, just like my residents. And so I think the great thing about your book is, I think in one spot, you've got some, you know, tremendous resources in Forever Dog to, you know, guide people who, oh my gosh, you know, my dog has this problem, you know, what do I do? Oh, look, page whatever. Or I don't want my dog to get into the shape of it has this problem. And, you know, kudos to you guys for, you know, making this available. And you disrupt a lot of thought processes in here which need to be disrupted. And I mean, we could go on and on about breed-specific food, and we could go on and on about toxins, which you and I have both experienced with our dog. And you mentioned glyphosate, and those of you who don't understand the word glyphosate, that's Roundup. And Roundup is in everything, and it's probably one of the best gut microbiome disruptors, best leaky gut causes, and changes how mitochondria make energy. And You're right. It's in almost all commercial dog food, whether you know it or not, and it's actually in almost all of our commercial food. So we could have a whole story on that. Anyhow, where can people find it? Where they can find out more about both of you? I follow you on the web, etc. I get your emails, blah, blah, blah. How do you do it?
So the quickest way, Dr. Gundry, would be foreverdog.com. You'll be able to find the links to all our pages and all our social handles where we'll be. And there'll also be a great interview where we sat down with you a few years back and smashed it out to like 25 million people. We had an awesome discussion about lectins and dog food. And I believe we also talked about glyphosates and things like that in the food. So foreverdog.com is where everyone can find us.
That's easy.
Very easy.
All right.
Yeah.
Well, it's great seeing you both again, and great success with the book. Everybody needs this. Believe it or not, I've learned some things that I didn't know, and thank you for that. So, boy, if I can learn some things, good, good for you. So, nice work.
Thanks, Dr.
Thanks so much,
Gundry.
All
Dr.
right,
Gundry.
take care. And now it's time for our audience question from Agambre 19 on Apple. I hope I fractured that. I'd love to know your thoughts on supplementing resveratrol and NMN, Dr. David Sinclair on my mind, and also your thoughts on spermidine supplementation. I'm 26, and to quote Dr. Hyman, looking to die young at a ripe old age. Thanks in advance and keep it up. Well, let me start with the last. Believe it or not, the quote, die young at a ripe old age, is actually the subtitle of my longevity paradox. So, and I guess I appreciate Dr. Hyman passing that quote along. But yeah, that's from me, and that's what we want to do. As many of you know, I'm considered a good friend of Dr. David Sinclair, and I am a big fan of resveratrol and various compounds in the nicotinamide family. There are a lot of ways to skin a cat with these compounds, and I think they're useful. I think they're a part of a program of increasing your odds of dying young at a ripe old age. But I think, as I tell anyone, really, if you are going to implement one thing and one thing only to extend health span and lifespan, intermittent fasting, which you just heard about in dogs, is probably the #1 effective method. And you'll soon see in my next book, Unlocking the Keto Code, how profoundly effective time-restricted eating, intermittent fasting is in hitting the same genes that resveratrol and MNN hit. So, hope that answers your question. Now it's time for the review of the week. Oh, and she just wrote the same review, Gombre 19. Every episode is worth a listen. It may just save your life. I've been a big fan of Dr. Gundry for a while, and I can say without a doubt, every episode of this podcast is worth your time. Whether you're trying to improve your health, stay healthy, or stay ahead of the curve on the most current health conversations and breakthroughs, there is something here for you with Dr. G, a trusted source and brilliant guy. Thank you, Dr. Gundry, for bringing the science that us armchair health nuts and biohackers need to know out in the open so that we can take control of our health. 5 stars all day long. Wow. Well, thank you very much, Gombre 19. And for those of you who are watching or listening for the first time, please send us a review on iTunes, and maybe you're going to get read. And again, thank you for these comments. This is why I do this. This is why I get up every day and see patients 6 days a week, to bring you the important information you need to know to take control of your health. Because nobody else is going to do it for you. And you know why I do this, because I'm Dr. Gundry. and I'm always looking out for you. We'll see you next week. Before you go, I just wanted to remind you that you can find the show on iTunes, Google Play, Stitcher, or wherever you get your podcasts. Because I'm Dr. Gundry, and I'm always looking out for you.
Welcome to the Huberman Lab podcast, where we discuss science and science-based tools for everyday life. I'm Andrew Huberman, and I'm a professor of neurobiology and ophthalmology at Stanford School of Medicine. Today, my guest is Dr. Justin Sonnenberg. Dr. Sonnenberg is a professor of microbiology and immunology at Stanford School of Medicine, and one of the world's leading experts on the gut microbiome. The gut microbiome
Hi, and welcome to your daily face-lifting massage routine. Now, this routine is designed to do of a morning or a nighttime when you're putting on your serums or your moisturizer to really help to eliminate toxins and improve lymphatic drainage, to reduce tension in the muscles that cause fine lines and wrinkles, to increase blood circulation and give your skin a healthy glow, and to improve muscle tone. Now, without further ado, we're going to get straight into it, but so many of you have been asking to see a picture of my grandmother who inspired all of my facial Pilates and massage routines. So wait until the end and I'll show you a picture of us together. So let's get started.
We're going to start by applying some oil. This is an important step to make sure our hands glide smoothly over our face. I love using jojoba or rosehip oil. Today I'm using jojoba oil. So just warm that up between the hands and then gently press into the skin all over the face and neck, making sure that you have all areas covered. Now we're ready to begin. We're going to start with eyebrow acupressure using our thumbs and index fingers on both hands. Place the thumbs just under the very start of your inner brow and rest your index fingers on your hairline. Apply a firm but comfortable pressure to the area under the eyebrow and hold. This is known as acupressure point UB2. It is great for sinus relief, headaches, and also releasing tension in the muscles. That achy feeling is the tension in the muscles being released. We're now going to move on to our forehead massage. So taking the knuckles of your fingers, gently press into the center of your forehead and move in an outward direction towards the temples, applying enough pressure so that you feel a beautiful release through the area but without dragging the skin. This relaxes tension in the forehead muscles and really helps to reduce wrinkles in this area. We're now coming into our eyebrow massage. So place your thumb and the knuckle of your index finger around each eyebrow. Start from the center and gently glide over the entire eyebrow, tracing the shape right to the very end and then keep repeating. This is once again excellent for releasing the tension we get from furrowing our brow when we concentrate or when we're squinting from the sun. It helps to reverse the stress that we put on those muscles. We're now going to massage out those 11 lines between the eyebrows. So taking your index fingers, you're going to glide them between the brows and up towards the hairline one at a time to help to release tension, increase blood flow, and also help to eliminate the lines we get when we're frowning. After this exercise, you'll feel a sensation as though your forehead is lifted. It really is incredible how quickly you can feel the benefits of this massage. Now we're ready for our eye acupressure. So using your opposite hand, place it just above the outer corner of your eye and lift gently, while pressing your middle finger into the outer corner of your eye. This acupressure point is called Taiyang, or gallbladder 1, and once again it is excellent for relieving tension headaches, but also releasing tension in the muscles that cause lines in the outer eye area. Keep a nice firm pressure on that area. We'll now repeat that on the other side. So just place your opposite hand above the outer corner of your eye and lift gently. Now press your middle finger into the outer corner of your eye. As far as how much tension you should apply, it should be firm enough that you can feel a dull, achy feeling, which means you're releasing the tension in the muscle, but only go as far as you feel comfortable. You shouldn't feel pain. Remember, this is a nice, relaxing massage. Make it your own. And now for our under eye smoother. So you're going to take your knuckles of the index fingers and start at the inner corner of your eye. Run your knuckles under the eye and out towards the temple, and then keep repeating. This movement assists with lymphatic drainage, eliminating toxins and reducing fluid retention and puffiness under the eyes. This one is a must-do if you suffer from under eye swelling. Once again, applying firm pressure but not dragging the skin. We're now going to make an L shape with our hands and place the edge of your index fingers beside your nose and your thumbs under your chin. Glide the hands towards the ears and then smoothly draw the fingers down the outer face and the neck towards the collarbone. This is excellent for lymphatic drainage and eliminating toxins and fluid retention. We have lymphatic drainage points at the collarbone, so think about drawing all the toxins to the outside of the face and then down towards the drain. I always find that this visualization helps. Now for our cheek lifter, we're going to take the knuckles of the fingers and press firmly into the area just under the cheekbones. This is an excellent way to relieve tension in the muscles that can draw the cheeks down. We're also pressing into acupressure point SI18, another excellent point for sinus congestion and pain. Now for one of my favourites, the jaw definer. Once again, take your thumb and the knuckle of your index finger, start in the centre of your chin and glide along the jawbone up towards the ears. We hold so much tension in the lower part of our face, especially if you grind your teeth or clench your jaw. This helps to relieve that tension and rejuvenate the lower part of your face. A nice firm tension pressing in under the chin and feeling those muscles relax. We're now coming into our final exercise, the neck release. Now with your peace fingers, place them either side of your ear and run your fingers down along the side of your neck towards the collarbone or the clavicle. We're tracing a muscle called the sternocleidomastoid muscle, which can hold a lot of tension. It feels incredible to massage this area and help to eliminate the stress we hold in our neck from working at our desks and looking at our phones. It really helps with posture and alignment. Now for the other side, so just placing those fingers either side of your ear and running the fingers down towards the collarbone, massaging that muscle. This one feels excellent at your desk or after a long day at work. Massaging out the neck can have so many health benefits. And we have now completed our entire massage routine.
Thank you so much for joining me for this daily face-lifting massage routine. Now, as promised, here is a picture of my grandmother and I together. She's 85 years old. We have such a special bond because she inspired me to get into my face exercises and my massage routine. We have also share a love of sewing together, so we're really close. And yeah, I think she's just beautiful and an inspiration to me and everyone around us. So there you go, there she is. Thank you so much again for joining me, and I can't wait to see you at the next one.
You just did not know how to go on. You wake up each day as if there is a hole deep in your heart and nothing can fill it. Eventually you start to lose hope and you just let yourself decay in your bed, unwilling to experience life. This is the state that Kierkegaard called despair. And I think it is a fairly accurate label. Despair for Kierkegaard is the emotional state of not just being scared of death, but being scared of continuing to live. It is a dark cloud that descends on the whole of reality, and it is a state that Kierkegaard knew well. His brilliant book, The Sickness Unto Death, explores what despair is, how it arises, and what can be done about it. Before we get started, it's worth noting that Kierkegaard was very much writing from a religious perspective. He's as much a theologian as he is a philosopher. But since I still think his ideas have brilliant insights in a non-religious context, I'll be secularizing some of them for the sake of this video, and I beg the more theologically inclined of you to be patient with this presentation. As always, I urge you to go and read Kierkegaard's book for yourselves, as I cannot talk about all of his ideas about despair in full detail here. But without further ado, let's get started. 1. The origins of despair. One of my childhood friends suffered and still suffers with severe depression. I remember once having a conversation over coffee with her one time, and she came out with such a poignant way of describing her mental state that I just had to write it down. She said, "It is like I cannot bear to be aware of things. Every thought I have about the world or about myself just sinks me deeper into misery." I'm sure that many of us have had this feeling, be it for a single day or for whole years. And I'm struck by how similar this description is to what Kierkegaard says is the origin of despair. For Kierkegaard, despair is a uniquely human condition because we are the only creatures that can stop and reflect on our experiences in the world. We can consider questions of meaning. We can ask why things are the case. We can examine our own characters and find ourselves lacking. We can look to the future and yet see no hope. All of this is only possible because of our human ability to think, to consider, to reflect, and to theorize. This ability has brought us everything from the steam engine to the poetry of Dante Alighieri. But according to Kierkegaard, it is also what makes us able to despair. And this is where Kierkegaard has a genuinely beautiful thought. He says that since the possibility for despair is just a side effect of something really quite amazing about humans, our ability to despair isn't far from a virtue. Here he is not romanticizing depression, but instead saying that the very fact that humans can fall into despair is a testament to the brilliance of our species and our ability to think deeply about things. Kierkegaard also says that if used correctly, despair carries with it the possibility for great growth and development. He is not saying that every bad mood is transformative, but he does say that moving through despair, getting to its roots and finding a solution to it will inevitably change your character and give you a deeper insight into how your own mind works. From his perspective, despair is just a step in the path of getting closer to God, but it has secular value as well. I like this thought because we so often refuse to recognize that despair has the potential to alert us to things that we don't like about our lives. It was only when I fell into a deep despair during my second year at university that I completely turned my life around. Again, it is not that despair is inherently positive or transformative. Kierkegaard is just pointing out that we ought to pay some attention to our despair, as it might be telling something that we really ought to listen to. If nothing else, if you don't notice that you're miserable, it's not going to stop it affecting your life, but it will prevent you from doing anything about it. Kierkegaard thought that the ultimate cause of despair is when our relationship to ourselves is somehow misaligned. He thought that this was due to the despairing person living outside of a proper relationship with an eternal God, and he thought that we cannot have a healthy conception of ourselves outside of our relationship with God. But we will revisit this position later on and see how some of Kierkegaard's insights can help not just the religious, but anyone who is struggling with a problem of meaning in their lives. But Kierkegaard goes one step further than almost any other thinker by recognizing that not all despair is created equal. Despair has subtypes, and it is incredibly individual, and this is what we will move on to next. If you want more on philosophy and the art of learning, subscribe to my email list. The link is in the description. 2. Despairs of excess and despairs of limitation. Imagine two people, both in extreme distress. One of them is a prisoner serving a life sentence. They feel trapped in their tiny cell, and they have no hope that their life will ever get better. They can see only one route ahead of them in life, and no other possibility even crosses their minds. Robbed of hope, they despair. The other is someone we might call a complete daydreamer. They spend their days wandering about thinking of all the possible paths they could take in life. One day they want to be a lawyer, the next day they want to be a doctor, then they want to be an artist. They constantly put off making any decision until one day they wake up and realize that it is too late to do any of these things, and they too fall into despair. These characters illustrate two genres of Kierkegaard's idea of despair that I think is incredibly relevant even in our secular world. I call these despairs of limitation and despairs of excess, respectively. Despairs of limitation feel like being trapped on one road in life with no possible way of diverting your course. In Kierkegaard's words, it is when we have no conception of infinity or of possibility, and so we feel both confined by our mortality, but also trapped by how we've chosen to spend our finite time on this earth. This is the person that cannot conceive of their circumstances changing, or of possibilities they have, or of choices they can make. They cannot conceive of anything greater than themselves, and they find it difficult to subordinate their moment-to-moment desires to some higher power or set of values. Living with this sort of despair is like pacing around a prison cell when the door has been unlocked this entire time. The confines of the mind have grown so rigid that imagination is almost entirely lost. It is easy to see how such a state could lead you into mental disarray. According to Kierkegaard, most people suffering from this sort of despair prefer to blend into the crowd and try and ease their pain through some sort of material success. But no amount of money will buy them out of their mental prison. And one day, in a moment where they can no longer distract themselves, despair will whisper its poison into their ear once more. On the flip side, despairs of excess seem somehow less obvious. It is difficult to see how conceiving of too many infinite possibilities could be an issue. But the dreamer in our short tale is a good illustration of exactly how this can happen. If your mind only dwells on the infinite possibilities of the world, then it's very easy to forget to do anything with your life. I remember a comedian in the UK, David Mitchell, describing how he realised when he was a teenager that he would never win Wimbledon. He had never played tennis and had no plans to. But that was the moment that he realised that no matter how hard he worked, no matter how many hours he put in, he would just never catch up. That possibility was closed off to him now. This is what will eventually happen to somebody suffering from a despair of excess. In one moment, all of their dreams and ambitions will turn to dust, as they realise that in keeping all possibilities alive, they have simultaneously condemned them all to death. But even if they pick one path and stick to it, the person despairing of excess will not be satisfied. They might be the best surgeon in the world, but they wonder what would have happened if they pursued their passion for painting. They are constantly tormented by what might have been, even if reality is actually quite pleasant. I love these two genres of despair because it really brings home something I don't often see people talk about when it comes to misery. People need different solutions. If someone feels trapped in an unhappy marriage, their despair is going to need a very different approach to someone who cannot commit to anything in life. I know it sounds obvious, but this bare fact often goes unsaid, and Kierkegaard's work brings out the immense diversity of human suffering in all its technicoloured glory. But what about those deeper pits of despair? Ones where it seems hopeless to even try and climb out? Well, that is exactly our next point. 3. Despairing at despair. I remember when I was at my lowest. I had no real friends, no joy in life, and had lost the conception that anything about my situation could change. Suffice to say, it was not fun, but I noticed something truly peculiar about being in such a deep mental hole. Eventually, the object of my despair was not my situation, but the despair itself. I was no longer waking up dreading the pain caused by my medical condition, but I instead was dreading my own misery. My despair was initially a reaction to events in my life, but soon it became the very thing that I was despairing over. In other words, my despair had become its own fuel, and thus was self-perpetuating. And this is precisely what Kierkegaard says happens to those who are deep in the dungeons of their own minds. Kierkegaard argues that despair can cause us to become self-obsessed. He doesn't mean this in the sense of becoming vain or arrogant. In fact, it's quite the opposite. He means that we become obsessed with our own despair. We're constantly thinking about it, trying to comprehend it. We become ashamed of it because we see it as a sign of our weakness and an affront to our pride. And this can have disastrous effects. Firstly, it can cause us to retreat into a life of moment-to-moment hedonism. In an attempt to run away from despair, we just shut off our ability to reflect entirely, and we pledge to not think about anything. The trouble with this approach is that since Kierkegaard thinks humans are just thoughtful and reflective creatures, one can only run away from their minds for so long before it starts asking questions again. But perhaps the most dangerous of the possible reactions to despair is that of defiance. This is where we learn to hate the situation and ourselves so much that we resent the entire world and everything in it for our wretched fate. At this point, we cling to our despair as the only certainty in our world. We reject any and all attempts by others to help us or to improve our situation. We begin to believe that we are uniquely hard done by, victims of the universe itself. As Kierkegaard puts it, once the despairing man would have gladly given everything to be rid of this agony, but he was kept waiting, and now that's all past. He prefers to rage against everything and be the one whom the whole world has wronged. And I think there is some real wisdom here. After all, which of us in a moment of despair or deep sadness has not taken it out on a close friend or a loved one? It is a classic trope of the miserable person that they hurt those that they love the most. And Kierkegaard helps us to understand why. Despair is an intensely confusing state to be in. Nothing seems to make sense in a satisfactory manner. We either feel trapped or paralyzed, and it seems to us that there is nothing that can be done to improve our situation. In such a feeling of helplessness, any hope or help or love offered by others strikes us as mockery. So it's no wonder that we react with anger and indignation. How could they understand us? Our acute suffering is like nothing the world has ever seen before, or at least that's how it seems to us. And to begin to identify with one's suffering like this makes it all the harder to get rid of it. Then it becomes a part of you. For some, it can even become the justification for their existence. They are the uniquely wronged person, and it will be intolerable to accept that they might be able to better their situation, that there might be a route out of despair. I'm sure we've all met people like this, and perhaps we've even been people like this. I know that I have. Kierkegaard describes this sort of person with startling precision for someone over a century away from our world. But what to do about despair? Luckily, Kierkegaard has a solution. 4. The necessity of faith. Of course, Kierkegaard says that the answer to despair is ultimately a full and thoroughgoing embrace of Christianity, but the benefits he attributes to a faith in God can ultimately benefit anyone, provided they're willing to accept a higher power or a higher set of values. In other words, something greater than themselves. Kierkegaard says that the part of the cause of despair is that we are conscious of the fact that we are mortal, but we can conceive of the immortal, of the transcendent. That is, we are ourselves, but we can conceive of something much, much greater than ourselves, and we yearn to be a part of whatever that thing is. This is not a perspective unique to Kierkegaard, or even one that necessitates a belief in God. Even much more secular thinkers like Camus, Nietzsche, and Sartre think that we have a longing for a greater meaning or power in the world. Kierkegaard says that Christianity does this job extraordinarily well through its idea of Jesus as the God-made man, because it makes a higher power that is nonetheless still close to us as humans. But our higher power does not need to be a Christian belief. There are many things that can theoretically fill the role of a higher power. It might be certain moral values like kindness or generosity. It might be striving to make one's own values in light of a godless world, as in the case of Nietzsche. But whatever the higher power is, there is an important obstacle in our way, and that is reason. Albert Camus makes this point better than any other philosopher I've read. In order to submit to a higher power, we have to regard something as meaningful in some objective sense. If we merely view it as subjectively meaningful, then we're not actually seeing it as a higher power, because it's only sustained by our belief in it. But as Camus points out, there is no way of spotting objective meaning. How would we know when we'd found it? We can't touch or smell it. It is meant to be everywhere at once, yet at the same time completely indetectable. This is ultimately why Camus wants us to move past the idea of meaning altogether. But Kierkegaard has a fundamentally different approach. He invokes the concept of faith. Faith has become fundamentally unsexy in this post-enlightenment world, but I think it does play a slightly bigger role in our lives than we give it credit for. Faith, in this less grandiose sense, is just the leap that takes us from uncertainty to certain enough to get on with our lives. When we trust that our partner is not going to cheat on us, or that our friends love us, or that the world will not end tomorrow, we are showing some degree of faith. We are saying, I don't know this for certain, but I'm going to trust in it nonetheless. At the very least, I'm going to act as if it's true. This is not a rational maneuver. It will be rational to doubt something just to the extent that it's likely that it's false. But we cannot live like this. We just don't have enough mental bandwidth. So in our everyday lives, we have to use faith instead. Kierkegaard is asking us to take this leap of faith in the problem of meaning. He agrees that you can't base your meaning-given principle on reason alone. Whether you believe in God or of morality or just that a particular aspect of your life is actually meaningful, Kierkegaard says that you have to use faith, otherwise the meaning just won't be there. And I think there is really some wisdom in this. It recognizes that existential solutions in our lives may not be rational. Just as there is no reasoned justification for our hungering over objective meaning, there is no reasoned way of arriving at a solution to it. But for Kierkegaard, living without faith in anything is signing yourself up to despair. And his position is definitely one worth considering, whether you're devoutly religious or staunchly secular. But if you think a leap of faith is not for you, then check out this video to learn how Camus attempted to solve the problem of meaning while remaining totally rational by just asking us to forget about meaning altogether. And stick around for more on thinking to improve your life.
The question I get is, so Irene, how do I start? And you'll probably have that question today as I talk about how trauma is really released. We'll define what trauma is. We'll define what release actually means. It's not what we often think it is. And I just wanted to start off with that. I am a somatic experiencing practitioner. I'm also a Feldenkrais practitioner, and I'm trained in something called somatic practice. And I have two science degrees, one in exercise physiology and one a master's of research in biomedical and health science. So this is my world. This is my expertise. I've been doing this work since I graduated from high school in 1993. So wanted to just give that little overview for those who are new to me. So this concept of how do we, first of all, what is trauma? What is release? And how do we really release trauma from the body? And to get into this, I first need to define trauma from this, we would call it new traumatology point of view. So the new traumatology point of view, or way of looking at the human system, is really been birthed and born out of my predecessors, most of which are still alive, namely Peter Levine, Robert Scaer, Bessel van der Kolk, Kathy Kane, people that have really understood and have worked in clinical practice and teaching others like me how to work in their practices, that trauma isn't something that is within the event. It's not the car accident. It's not the attack. It's not the injustice. It is what happens in the physiology. And I'm also going to make one distinction. I am open to all sorts of different ways of talking and using verbiage. If you were to go to the hospital because you got into a car accident, again, for example, you would most likely, and if you needed surgery, you might see a trauma surgeon. So those surgeons or those places in hospitals, the trauma wing, if you think of shows like Grey's Anatomy, yes, that is, they're treating the body, and the body had a hurt or an accident due to an event, and therefore they are helping with those traumas. That's one way in the medical world of defining a trauma. In this world of nervous system health and working with things like complex PTSD, various forms of mental illness, which we are knowing now are actually a form of physiological illness that show up in the psyche, chronic illness, heart disease, certain cancers, autoimmune, addiction, trouble connecting with people, trouble being able to sense our own bodies. All of these are connected to some form of what we would call dysregulation in the nervous system. So again, coming back, trauma, from my point of view, is not the event per se. It is in the actual physiological body, somatic systems, the nervous system. So that's number one that we have to understand. Number two, what is the nervous system? What is the body? And I know that, you all have a body, and some of you are going to be more adept and more skilled at being and masterful at being with this physical body of ours. Some of us are very good in say athletics and physical sports. Some are really good with more mind-body techniques. Some of us are not well in our body. But the nervous system, the autonomic nervous system, the ANS, this is responsible for our automatic pieces. So I have to lay these foundations. The autonomic nervous system is comprised of two main nervous systems. One is the sympathetic nervous system, one is the parasympathetic nervous system. I'm not going to get into all the details. I'll mention where you can learn more of that in a second. But the sympathetic nervous system is more of the get up and go, fight, flight, protect, attack, defend, get the heart rate and blood pressure up so that we can climb a flight of stairs, so that we can run down the street, all these sorts of things. It gives us more blood to our muscles and to our system so that we can act and move and be engaged and stimulated and activated. The parasympathetic nervous system is often dubbed the more slowing down, rest digest system, but it's actually way more complicated than that. And this is where something called the polyvagal theory, or the understanding, I should say, of how the vagus nerve works and how it relates with the parasympathetic nervous system comes into play. I've done an entire lecture on these vagus connections, vlogs on it, so we can pop in one where I talk about what the polyvagal theory is, and I did a special topic lecture just on this. The polyvagal theory is not just about the vagus nerve. This is the other thing. It is about how we as humans interact with our physiology and the environment in a hierarchical fashion, depending on the stress and situation at hand. If I'm having a nice chill moment with you guys or group around a campfire, one would hope that I'm in a more slow down, easy, chill, rest, digest, socially engaged mode. If I am under threat or under attack, I'm going to come out of that chill mode and I'm going to go into more sympathetic fight flight mode. If I can't fight or flee and I'm like, I give up, I can't get out of this sticky, tricky situation, my system goes into what we might call a freeze or a shutdown or a collapse, which is part of the parasympathetic. So the parasympathetic's complexity is this concept of polyvagal. And it is nothing more. I mean, it's a big deal, but it's this concept of these different spectrums and different systems that our neurophysiology and our neurochemistry have to cascade through to when we are safe and feeling good and warm and fuzzy, or when we are not and we are needing to go into protection mode. So the parasympathetic it has more nuance. I'll leave it at that. When we have stored trauma, I like to call it survival stress, this impacts the ability for our autonomic nervous system to function properly. The other thing that I didn't mention about the autonomic nervous system is it not only governs the fight, flight, freeze, it also is in charge of how we digest things. So like if I drink a bit of water here, if you've got a drink next to you, you can do the same and imagine this. I don't have to teach myself how to swallow. I don't have to teach my body how to bring that water and that liquid through my stomach, through my intestine, small intestine. I don't need to. It just happens automatically. Thank goodness, right? That is automatic. So the autonomic nervous system is responsible for that stuff that goes on in our system. It's responsible for hormone release, how our immune system keeps us safe and protects us from whatever is within and around us. It is responsible for our heart rate shifting and changing, our blood pressure, our respiration, right? If we start to climb up a flight of stairs, we need to start our increase in our respiration, inhale, exhale, blood pressure goes up to meet the demands of the act, movement, task that we are doing. So automatic nervous system, autonomic nervous system is just what we need. The thing that's interesting is that when we have got things that occur to us, we typically call them traumas, right? I had an emotional trauma, I had a physical trauma, I had a sexual trauma, I had a medical trauma, all these things. That's fine. I think it's fine to say that, but I'm trying to be a little more accurate in defining, is it a trauma or is it that the system is dysregulated as a result of that event or that series of events or the generational past or the abuse? I prefer the word abuse to trauma because someone may have a certain type of abuse and then another person has the exact same type, and how they deal with those different hardships, shocks to their system, abuses, scary, bad thing, it is determined by how their internal physiology and how their autonomic nervous system was originally wired when they were young. So now I'm going to funnel into how this all starts and how we often fail to know how to process these hurts and harms and bad, scary things because of what occurred to us when we were young, in utero, to our parents before we were even born, which sets them up to either know or not know how to work with us and help teach us as little human animals when we're young. So again, I'm going to go back. This idea of trauma, again, in my suite of words and how I describe this, it's not something that's in the event. It's how it ends up in the system, whether it is what we would call dysregulation, somatic stress, and also know that when trauma and trapped stress, these fight, flight, freeze responses get trapped within us, for some people, it impacts the cardiovascular system. For some people, it impacts the gut. For some people, as I mentioned, it impacts how we think, how our psyche works. For others, it affects the immune system. For others, it affects their need to have external coping and soothing mechanisms to bring themselves down. This would be addiction. For some, it is going into really toxic environments and or relationships over and over again. For some, it is none of the above, but it's constantly self-sabotaging ourselves and feeling like we're no good or we have no purpose in life, et cetera, et cetera. So just to wrap that one up before I get to the release part, trauma is something that is not necessarily, in my opinion, and from my experience in the event, it is how an individual acts, responds, feels, processes the outside bad, scary thing that happened, and then whether or not that gets stuck and embedded in the system. Now, if we think about something really simple, so let's just say you, and this is like my common go-to example, you're walking in your home and you stub your toe on a coffee table or something on the ground, and it hurts like hell. In that moment, that very benign, but I've broken a toe doing that, so it can really hurt. The system goes into a stress response. It goes into a sense of something's not right. Oh gosh, there's a piece of bone that got broken, or maybe there's a ligament that got torn, or maybe you've cut the skin. Again, you don't have to think, send out the army to protect and send the blood cells so that it starts to stitch up the bone or the tendon or the cut. You don't think about it, it happens. But then there's this after effect, we could call it a ricochet or the fallout of that acute shock to the system, the sympathetic nervous system will often have a release of adrenaline. We might feel pain. We might feel emotion. We might get angry at the coffee table or at ourselves for not seeing it, or someone who moved the coffee table and didn't tell us. And so our awareness wasn't on point. Our system goes into a reaction, and our body wants us in that moment to pause and wait for that high stress to come down. Now, you might be saying, well, Irene, how do you know that the system wants us to wait? All I can say is, trust me, the system, human system, does not want to live spiked up in a chronic survival response. It wants to come out of the intense pain, the discomfort, the emotional flush that comes up. And so here's your number one. So I'm embedding these how-tos. From this day forward, and I say this to my students all the time, and it's probably one of the more underestimated things that you can do to foster greater capacity in your body system so that you can release and you can let go of the old abuses, hurts, harms, troubles, etc., that have occurred to you. By in that moment of stress, acute stress, by really, really feeling, and even just giving yourself maybe 30 seconds, a minute might be better depending on how severe it is, and to really sense, feel, connect, feel the pain. Don't ignore the pain. If there's a scream that needs to come out, granted, of course, you don't have children around you. You do not want to harm them or scare them if they're around. So this is where my example then takes a choose your own adventure. So I'll talk about that in a second. But let's just say it's safe for you to let all this stuff out. Feel it, let it out, process it. Now, I have an ebook. If you haven't picked up this ebook, it's called 7 Steps to De-Stress. We'll pop it in the comments, or it'll be in the Show More section if you're watching this afterwards. That ebook explains the stress response and why we want to really, not just for the sake of pausing and resetting in our day, when we have an acute stress, we want to work with it in the moment. And the reason why is because if we don't, it traps inside of us. It sticks to us. We stay in a chronic state of activation, fight, flight, or shutdown because we have shut off feeling that pain because it's just not convenient. So make it such that, again, like I said, from this day forward, make it almost a good thing that you are pausing when these things occur. Now, this could be stubbing your toe. It could be almost getting into an accident on the road. It could be almost slipping when you're in the shower. It could be hearing someone scream, not to you, but something that startles you. It could be a stressful conversation, et cetera, et cetera, et cetera. It could be an actual, true, real abuse, attack, that kind of thing. The thing I said about the kiddos, again, I'm sure there are people here who are parents, and a lot of times people get confused because they say, well, shouldn't we show our children emotional processing so that they learn it from us? And the answer to that is yes and no. It depends how old they are. If they are young and fully unaware of how to self-soothe their own body, and they're still relying on you, the care giver, to teach them self-regulation, no, you need to actually find a way to feel that hurt and pain and process it later. So we'll talk about that too in a second, because if they see that mom or dad or whoever isn't able to keep it together and freaks out, the child will inevitably default to something wrong is happening. I have to change myself to take care of mom, dad, grandma, grandpa, nanny, whatever it might be, older sibling. Even if that child is an infant and can't make sense of what's going on, they will shift their physiology to protect themselves from the outburst that their caregiver has put out. So this is kind of one of those caveats where, depending on the age of the child, to help them not take the stress of our traumas, events, bad, scary things, hurts, harms, etc., we have to then maybe process that later. And that is as simple as having a moment later that day or the next day where we conjure up the memory of that accident, harm, hurt, and we work with our physiology to track the things that we might have trapped inside. Now, this is more advanced, and this is, of course, what we work with and we teach our students in our programs, but I just wanted to give you that concept that sometimes we can't work on something in the moment. It might not be safe to do so. Maybe it's a more serious accident and we have to go immediately to emergency and we've passed out and we have to get something fixed. But then after the fact, that's when we want to then work with our physiology, track it, see what's stored, what is suppressed, what is depressed in the system. Okay, so just following me here, I started with defining what trauma is. I gave you a very brief introduction to the autonomic nervous system. I gave you this example of stubbing our toe as a little minor, we would call this shock trauma, and how being able to process and feel what is going on will allow us to come out of that high intensity shock state. Now, the next question might be, well, you know, do I have to shake? Do I need to do this? And this is where this gets really interesting, and there's so much misinformation out there. Releasing something that's trapped in the system is not cut and dry. Releasing something in the system is not just shaking. For some, it might be. For others, it might need to be emotions that come out. It might need to be words that need to be spoken. It might need to be movement patterns that weren't allowed to come out that have nothing to do with shaking. And so this is where it gets really tricky to say release is like this, because each of us is unique in our history, each of us is unique in our capacity, and each of us will be unique in how we process. I prefer the word integrate to release, how we bring up and sense and feel and then integrate what is coming up so then it can settle and dissipate and come out. For some, feeling tingles in the body, feeling heat, feeling cold rush through the body, feeling a bubbling up of an emotion, and then being with that emotion and expressing whatever might need to come out is what is the release. It might have nothing to do with physical body parts moving. So I just wanted to kind of set that tone as well as we go a little deeper into this. One of the classic knowings that we are trapped in survival stress and have lots of trapped traumatic stress inside of us, in our organs, in our systems, is that we aren't able to be in the here and now. So even as I say that, just take a second. There's 151 people here. As you've been listening to me talk, have you been connected to your body? Have you been connected to feeling your breath? Have you been connected to feeling the ground under you? How are you connected to your somatic body self while you're engaged in this learning mode here? And one of the things that is most difficult for humans to get is that we have animal physiology, right? Other mammals in the world have those autonomic stress, survival, parasympathetic systems. For many animals, our internal viscera, our organs are the same, with maybe some tweaks, but mostly the same. And so we have this animal somatic mammalian body, but then we have this higher brain. And this is where knowing how to release trauma is not as cut and dry as an animal in the wild who might defend their territory, might shake after a real scary event. You know, if you've ever seen dogs, they'll shiver and they'll shake. They'll release tension by doing a shake, by doing a stretch. And it's not like that cat is thinking, okay, I'm going to get up and do some downward cat or downward dog. When if you see a cat or a dog and they get up and they do those stretches, it is an automatic response in their body to reset the tone in their muscles so that they can act and walk and be agile and nimble and be there for threat if it comes. So another little nugget here of how we gain more capacity to release stuff that's stored inside is we start to follow impulse in our body. We start to follow the things that occur internally that we often don't think of. This concept of how we follow our impulse. So the first thing I started with, again, a little bit of education, right? We always want to start with education. The second piece is dealing with stressors and troubles in the moment, in the now moment, so they don't stick. And that takes practice. As humans, we have overridden, we have overridden our stress responses because we have this higher brain. So this is why I was doing that little preamble of we're human, we have animal physiology, and we have this higher brain that is so darn smart and so darn complex that it can actually shut down and disconnect from what's happening in our physiology. This is a problem. It's okay when we're in a moment of absolute abuse, perhaps. We will maybe have to dissociate to handle what's happening to us. This is what occurs with folks who have had severe abuse, torture, that kind of thing. They will really disconnect from their physiology because it's too much to sense and feel. You know, we see this in private practice. We hear about this in stories, movies, all sorts of things that depict atrocities, and then the person is protecting. This is what we would see in say, dissociative identity disorder, used to be called multiple personality disorder. It is a way to cope with all of the stuff that's happening. So our higher brain can protect us, and that's a good thing. But if we are no longer in the traumatic stress, if we're no longer in the event that occurred 20 years ago, 30 years ago, 40 years ago, or even generationally to our ancestors, if we're not in that anymore, but we still have the wiring in our noggin up here to protect us, we need to do some work to help bring back more qualities of sensation to the body. So I'll pose this question. If you have a broken bone or say a cut, I will use my stub toe example, the system can't heal it in one moment. It takes time, right? And if your system is overstressed, if your system isn't getting good nutrients, if you're chronically dehydrated, if you're living in a toxic environment, if just the situation around you and the past is still on your back like a backpack, the ability for the system to deal with that cut or that broken bone or that shock trauma, let's just say, is less able. It can still do it, but it's going to take a lot of time for that cut, let's just say, to heal. And I know this from speaking with people who have autoimmune conditions, who are chronically stressed, who are living in what we would call chronic PTSD, which is the fight, flight, and the parasympathetic freeze just on all the time. Their autonomic healing repair mechanisms are dampened. They're under stress because the system is trying to just keep them safe. Even though there's no danger around them, there is a message saying danger, danger, danger. And so let's just say you get that cut, it's going to take a lot longer for that cut to heal when the system is under stress. The other example I'm going to give, if we think about a goldfish in a bowl of water, which is how you often see them, there's this concept in science, in biology, where if the fish is sick, do we help the fish or do we make sure its environment is healthier? The water is healthy, the water isn't filled with toxins, right? Do we just give the fish medicine and then plop it back into the environment that's toxic? Or do we clean up the environment and then let the fish respond to a cleaner environment, and over time it starts to heal? So I'm sort of laying that idea that would be called terrain theory, for example, where we change the terrain, we change what we're offering the fish for its nutrients and its goodness, its home. So for humans, when we have a cut, for example, I'm gonna pull this back together, don't worry guys. When we have a cut on our hand and our system is already under stress, it's gonna take a lot longer for that cut to heal, because the system is trying to figure out what it should fight next. Who should I attack today? You know, what should I forget? What should I disconnect from today? And it doesn't know how to address just that thing and go into healing mode. So all of that, let that settle. For us here today, I will make the assumption that many of you are here because you know you have old traumas, old survival stress. Your system is living in some form of fight, flight, freeze, some form of maybe dissociation, which is also called derealization, depersonalization, disconnection from the environment. We aren't able to even see what's around us. We're kind of like a walking zombie in a sense. Or the flip side, we are hyper aroused. We are hyper vigilant. We are always looking for the next thing to attack us. In this state, we will actually create drama. We will create drama to perpetuate the old traumatic expressions and wires in our body, because that's our MO. We know how to be that way. We don't know how to be calm and soothed and engaged with the world. It's foreign territory. So our system will keep looking for ways to keep us trapped. And I see this in students that I work with and in clients I saw when I was in private practice. We would be doing a lot of good work, or they'd be doing a lot of good work on their own, and they're feeling something shift, and it's so foreign that they second guess that that's even possible. Or they're like, well, this just seems too boring. I got to find a little bit more intensity to bring my system back up to what it's used to. So again, let's just say you're here because you want to understand how this trauma stuff works, how it is supposed to be released, how it is really released. As I said in the title, there's two situations that often people live in. Again, this sense of disconnection, dissociation, and then this sense of hyper aroused, looking for danger all the time. The interesting thing is they kind of play together, because someone who has more of that dissociative tendency is often like that, because the high alert, needing to look for danger all the time just became too exhausting. This is how someone ends up in what we would call adrenal fatigue, adrenal burnout, where the system is just collapsed. It has spent its whole life looking for danger, and it's maybe not there, but they're expecting it, so the system stays ramped. So again, hypothetically, you've got all this chronic stuff in your system due to the past that was scary, bad, and wasn't good. What do we do about it? First thing, education. You're doing that right now. So promise me that after this, you will do more education with me through my resources, through my programs, etc. The second thing is we have to learn how to follow our impulses. And by that, I mean tracking our physiology. So the reason I talked about that cut and I talked about these trapped things inside of us, if we are unable to notice small things like when we are thirsty, for example, or when we are hungry, or if we negate listening to our bladder when it is full and needing to void, when we are not allowing gas to pass up or down. Now, for those of you who have been around a long time, this is old news to you. But for those of you who are new, this is actually the holy grail of learning how to release our trapped traumatic stress. It's not some fancy technique where you tap it out. It's not some fancy breath thing where you breathe. It's not some fancy pushing of the muscles to get a shaking. It's starting with listening to these basic autonomic biological functions that are in our system. Because if we cannot hear them and sense them, if we can't notice when we have a tight muscle somewhere, or there's a pain, or there's a heat, or there's a tear, or an anger, or a sense of disgust, or a sense of sadness, or this desire to say something, if we're not tuned to these internal automatic responses, A, we're not connected to ourselves, and B, it will be very difficult to track the trapped traumatic stressors and where they are in the body. And we will go into the approach in a kind of one size fits all and just be like, oh, well, they've said that this is going to help me release trauma, so I'm going to go through these steps. But we're doing it from a cognitive external locus focus, as opposed to what is my system needing to bring up and out. So I'm going to pause on that. So again, education, and then understanding our physiology, and then being able to listen to our physiology. If I go back to my example of stubbing my toe, breaking my toe on the coffee table, that is an opportunity to teach myself how to feel in the moment, because it hurt in the moment. There's no denying it, it's there. Sometimes we need to understand that if a system has had not a lot of capacity, one question I saw float through is, so how do I heal early trauma? You've been talking about this shock trauma, accidents, but let's say there was no actual accident. It was just this general, nothing was ever safe. I didn't get connection that was healthy and secure from my primary caregiver. Usually it's the mother, but sometimes it's a father, sometimes it's a grandparent or a nanny, doesn't matter. Whoever that responsible older human was for us when we were young, if they didn't have solid regulation on board, they won't know how to attune to us. And then we will learn faulty attunement to ourselves. That's really important. Let me say that again. If our primary caregiver doesn't know how to listen to their own physiology because of their own trapped stuff, and then they can't listen to their own, so they can't understand us, and they're not helping us co-regulate and soothe, we then get faulty information about how to soothe our own autonomic system. This is what we would call one portion of early developmental preverbal trauma. So in that case, there's no actual one event. There isn't that one car accident. There isn't that one attack. There isn't that one natural disaster that obliterated the village that I was growing up in, for example. It's this low-level, insidious, always feeding the little one what it needs, but not in a way that's healthy. So the question is, or I should say, that is an instance where there might not be a shaking release. There might not be an actual memory of processing that horrific thing we saw. And this is where many people who have tried to do these cookie cutter approaches to getting the stress out by shaking, by breathing, for example, by getting hooked up to machines, sometimes it works. Sometimes, but often there's rebound. Maybe they feel a little bit better because there's been some capacity and flow given to the system, right? But the core level of wiring has not been impacted. And so if you know that your early stuff was more like what I just said, and someone just said, this was both my parents, this is where I'm going to sound like a broken record. Education, following your impulses, getting into your body, and then further to that, learning how to really orient to the here and now. As boring as it might sound, can you feel the pressure of your body against whatever you're sitting on? Can you have your eyes and attention see and explore the space around you and let that come into you or you go to it? When we, again, like I said, if we've had these scary things happen to us, consider an infant who's not being attuned to. They're crying and crying and crying, and the cry is the cry of, I'm too hot. I see this all the time in grocery stores. Baby is crying, and you look and they're beet red, and they're still all bundled up in their winter clothes. And it's hot in that store. These are true stories. I've seen this. And the mother doesn't know, or the caregiver doesn't know what to do. And I've seen mothers scream at their babies in stores. And it's like, look at the face. They're hot. I've already stripped my jacket off, you know. If that isn't attuned to, if that little one doesn't get what it needs, if that cry can't be listened to, the cry of that is very different than a cry of hunger, than a cry of a belly being a little distended and gas being held. The baby starts to not learn how to self-regulate. They are in a state of stress. And so why was I saying that? So we have to understand that if that was us, and even if we don't remember it, but I'm saying this to you now, and if something is landing, and if you're starting to feel maybe a little bit of anxiousness, or maybe you're going beet red in the face, then it's possible that that scenario I just gave you is triggering a procedural memory, a body somatic memory of something like that, where our needs weren't being tended to. So in a case like that, there ain't no shaking response to heal that trauma. It is you learning how to take care of your body now and listen to it now. See, this is why this isn't very glamorous. It really is some of these gentle lifestyle self-care nurturing practices that we didn't get when we were young, and we essentially have to reparent ourselves. It's not really inner child work necessarily. You could imagine that little one that was left to cry and be overheated or be hungry or be overfed. This is something that I've seen, kids being overfed, not wanting to eat everything, and they're being forced to eat stuff. That is a perfect way for someone to disconnect from their body. And then we wonder why so many people have trouble with eating cues and hunger cues and I'm full cues, right? It's been messed with in some way. So again, how do we release trauma? It depends on what the situation was. What I have learned in my practice and in my programs and working with people is that whether you have had a early trauma, like what I just talked about, maybe it's a medical trauma. This is a common thing. Babies are born and they need something fixed, right? And they need to get it fixed or else they'll die. They have to go into a little bit of survival physiology to handle that stuff. And up until this day, pediatricians, doctors, they still don't know that they should be sending that baby to a somatic practitioner to help it get its life force back because it's been dampened by that surgery. So that's one example. So sometimes it isn't just neglect and abuse, it's these real life events. Maybe there was a death in the family the day that we were born and mom was distraught. There are so many instances where this early stuff imprints on us. And then we wonder why doing these step-by-step things aren't working. It's because it's actually a lot simpler, but the simple is complex. Because if we are now saying I'm 45, so let's say you're 45, let's say you knew you were that baby that was not attuned to, wasn't securely attached to, parents hated each other, there was never any space for play and goodness, and there were conditions on love, and that's just how we were brought up. And then maybe along that lifetime, you had a car accident or something like that, and now you're 45 and you're like, well, where do I start? I start when I work with people all at the same level. We start with education,